Good morning, ladies and gentlemen. A very warm welcome to all our distinguished guests who are present here this morning with us for the Illness to Wellness Conference on the role of geriatric care in promoting healthy and graceful aging. Ladies and gentlemen, we will go ahead with the proceedings very shortly. Meanwhile, we would request everyone to be seated, be comfortable, and requesting for all mobile phones to be kept on to silent mode when we begin the proceedings of the conference. Thank you very much indeed. Once again, a very warm welcome. And we sincerely hope all our delegates, guests, would have completed their registration formalities. If not done so far, you may kindly do outside at the registration counter. Thank you. And a very warm welcome to all our distinguished guests who are present here with us this morning for this very important conference by Illness to Wellness on the role of geriatric care in promoting healthy and graceful aging. Ladies and gentlemen, we would like to inform we'll go ahead with the proceedings of the inaugural session in about 10 minutes from now. Meanwhile, we would request everyone to be seated, be comfortable, and also requesting for all mobile phones to be kept onto silent mode so that we can have a smooth, uninterrupted flow of our conference. Thank you. All our distinguished dignitaries are here with us and we are ready to go ahead with the proceedings of our conference today. Once again requesting everyone to be seated. May I request the food counters to be closed now? So ladies and gentlemen, to begin the Illness to Wellness Conference on the role of geriatric care in promoting healthy and graceful aging, we begin with the auspicious and ceremonial lamp lighting ceremony. I would invite our eminent dignitaries, Mr. Rajesh Bhushanji, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation, Professor Nirmal Kumar Ganguly, former Director General, ICMR, and Member, Governing Council, Illness to Wellness Foundation, Dr. Rajendra K. Dhamija, Member, Advisory Council, Illness to Wellness Foundation and Director, Institute of Human Behavior and Allied Sciences, Government of NCT of Delhi, Dr. A.B. Day, Founder and former HOD, Department of Geriatric Medicine, All India Institute of Medical Sciences, AIMS, New Delhi, and Chairperson, Geriatric Medicine, Artemis Hospital, Gurugram, Dr. Arun Agarwal, Chair FICCI Task Force on Active and Healthy Aging, former additional DGHS, Government of India, and Medical Advisor, Apollo Hospitals Group, and Mr. Anil Rajput, Chairperson, Advisory Council, Illness to Wellness Foundation, to kindly light the ceremonial lamp and formally inaugurate the Illness to Wellness Conference. And ladies and gentlemen, let's put our hands together on the ceremonial inauguration of the conference. A very, very important, pertinent, and a timely topic of this conference that we are going to have today, the role of geriatric care in promoting healthy and graceful aging. And as is customary in our country, we begin every auspicious occasion by lighting the ceremonial lamp, invoking the gods and goddesses to seek their blessings and success of all our endeavors. And I would request our dignitaries to kindly take their seats on the stage. Thank you. Inviting all our dignitaries to kindly grace the stage, Mr. Rajesh Bhushan, Professor Nirmal Kumar Ganguly, Dr. Rajendra K. Dhamija, Dr. A.B. Day, Dr. Arun Agarwal, and Mr. Anil Rajput. Namaskar and good morning, our esteemed dignitaries on the dais, distinguished dignitaries, eminent speakers, respected delegates, all our partners, members of the press and media, ladies and gentlemen. On behalf of Illness to Wellness Foundation, in association with Federation of Indian Chambers of Commerce and Industry, FICCI, it is my proud privilege to welcome you all to this very important national conference on the role of geriatric care in promoting healthy and graceful aging. Today's conference is a step in the direction of blending Asian wisdom with modern technology, preventive care, sustainable hygiene, and community-driven health education, which brings together policymakers, clinicians, researchers, and industry leaders to reimagine geriatric care as a cornerstone of a healthier India. And today we are honored to have with us the august presence of eminent dignitaries. I would request Mr. Anil Rajput, Chairperson, Advisory Council, Illness to Wellness Foundation, to kindly do the honors of welcoming our distinguished dignitaries on the dais with floral bouquets. I request you, sir, to welcome Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation. Request you, sir, to welcome Professor Nirmal Kumar Ganguly, former Director General, ICMR and Member Governing Council, Illness to Wellness Foundation. I request you, sir, to welcome Dr. Rajendra K. Dhamija, Member Advisory Council, Illness to Wellness Foundation, and Director, Institute of Human Behavior and Allied Sciences, Government of NCT of Delhi. We welcome Dr. A.B. Dey, Founder and former HOD Department of Geriatric Medicine, All India Institute of Medical Sciences, New Delhi. We welcome Dr. Arun Agarwal, Chair FICCI Task Force on Active and Healthy Aging, and former Additional DGHS, Government of India, and Medical Advisor, Apollo Hospitals Group. Thank you, sir. And now to formally open the proceedings, it is my honor to invite Mr. Anil Rajput. And Mr. Rajput has been a strong advocate of preventive healthcare, responsible business practices, and collaborative action for societal well-being. Let's put our hands together to welcome sir.
Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation. Professor Nirmal Kumar Ganguly, former Director General, ICMR, and Member, Governing Council, Illness to Wellness Foundation. Dr. Rajendra K. Dhamija, Member Advisory Council, Illness to Wellness Foundation, and Director, Institute of Human Behavior and Allied Sciences, Government of India, NCT. Dr. A.B. Dey, Founder and former HOD, Department of Geriatric Medicine, All India Institute of Medical Sciences, New Delhi, and Chairperson, Geriatric Medicine, Artemis Hospital, Gurugram. Dr. Arun Agarwal, Chair FICCI Task Force on Active and Healthy Aging, former Additional DGHS, GOI, and Medical Advisor, Apollo Hospital Group. Ladies and gentlemen, good morning. I warmly welcome you to the Illness to Wellness Conference on the role of geriatric care in promoting healthy and graceful aging. A subject that is not only an important subject, but deeply sensitive. Today, at the outset, I would like to compliment our Honorable Finance Minister, Shrimati Nirmala Sitharaman, for presenting a comprehensive and forward-looking vision for healthcare in India through Union Budget of 26-27. with sweeping reforms aimed at improving affordability, strengthening emergency care, advancing medical education, promoting biopharma innovation, integrating mental health, and expanding geriatric care. The budget marks a significant turning point for India's health system. Importantly, a strong and focused push has been announced for geriatric care. The budget outlines plan to develop a comprehensive care ecosystem covering geriatric and allied services, supported by the National Skills Qualification Framework, aligned training programs for multi-skilled caregivers. These programs will integrate core caregiving skills with allied areas such as wellness, yoga, and use of medical and assistive devices, with an ambitious target of training nearly 1.5 lakh caregivers in the coming year. And I would also like to take this opportunity to compliment Mr. Rajesh Bhushan, who I am sure would recall that few years back when he was Health Secretary, I had visited his office when we discussed that India needs to create a force which will be skilled in providing healthcare services for the old age people. And he was very kind to say that we can create a curriculum which can be used in our existing facilities like AIMS, etc., where a new stream can be created. It is heartening to note that government has finally taken note of that request, and an action has been initiated and announced. The budget has also placed a strong emphasis on mental health care, including the announcement of a second National Institute of Mental Health and Neurosciences in North India. This is particularly significant as mental health concerns are often under-recognized but has profound impact on well-being of the elderly. For us at Illness to Wellness, these developments are especially encouraging. The need for trained caregivers, a holistic approach to elder care, and the creation of sustainable ecosystem that supports healthy and dignified aging are issues that the Illness to Wellness Foundation has consistently highlighted over the years. It is reassuring to see these priorities now clearly reflected in national policy, and we look forward to meaningful collaboration in translating this vision into tangible impact on the ground. Friends, elderly population is rising globally. Improvements in life expectancy, healthcare, education, and income levels have led to significant shifts in population demographics across the world. India, in particular, is undergoing a rapid demographic transition. As per government estimates, the elderly population, those aged 60 years and above, is projected to more than double from about 100 million in 2011 to nearly 230 million by 2036. This means that by 2036, almost 1 in 7 Indian will be over the age of 60. The demographic shift is not merely a statistics, from the census. It is a live reality unfolding across our families and communities. With longer life expectancy comes a new reality. To ensure that these additional years are lived with dignity, security, and good health. However, for a large section of the elderly in India, this responsibility remains unmet. Many find themselves in vulnerable situations due to absence of strong institutional and familial support systems and face many interconnected challenges. Let me highlight a few of them. Health-related issues such as rising disabilities, stigmatized mental health conditions like dementia and Alzheimer's, inadequate geriatric healthcare infrastructure, and a sharp urban-rural divide in access to medical services. Economic challenges such as insufficient social security, rising living and healthcare costs, and limited financial resilience. There is also a growing digital divide, with many seniors struggling to adopt technology due to lack of training and access to age-friendly devices. In addition, our physical infrastructure, public spaces, transport system, and emergency response mechanism remains often ill-equipped to meet the needs of elderly. Beyond all this is social challenges that manifest in the form of weakening family support system, social isolation, neglect, and lack of companionships. This remains one of the most common yet least discussed challenges faced by seniors. Older persons are increasingly living alone. In India, about 5.7% of senior citizens live by themselves, and disability related to mobility, vision, and hearing further heightens the risk of social isolation and depression. With the rise of nuclear families and increased migration of younger generation in search of better opportunities, many aging parents are left behind. These are not isolated medical or social concerns. They directly affect independence, quality of life, and emotional well-being. From a broader societal perspective, this shift has also impacted our social value systems. In earlier joint family structures, grandparents played an important role in upbringing of children, imparting values, culture, and emotional stability. With the rise of nuclear families and both parents working, this intergenerational bond has weakened, leaving both children and elders more disconnected than before. This is where today's conversation becomes especially relevant. Geriatric care must be viewed as comprehensive ecosystem, one that integrates healthcare services, social security, community engagement, technology, and well-trained caregiving workforce. Around the world, this is increasingly becoming recognized as emergence of silver economy, an economy that responds to the needs of older persons, from healthcare and assistive technologies to well-being and caregiving. The silver economy has the potential to generate employment, By investing in structured training and skill development in senior care, India can not only meet its domestic needs, but also create meaningful employment opportunities globally, positioning itself as a provider of skilled geriatric care services. It is therefore encouraging to see that government has taken cognizance of this need, with this year's budget clearly reflecting a commitment to structured, standards-based training for caregivers as a central pillar of India's geriatric care strategy. While building a robust ecosystem for elder care is the need of the hour, caring for elders at home remains the first and most critical step in seniors' long-term care journey. Encouraging physical activity, providing nutritious diet, ensuring regular health screenings, and keeping seniors socially engaged can go a long way in promoting healthy aging. We have with us today very eminent personalities who have wide knowledge on this subject. I welcome them once again and look forward to hearing their insightful comments on the measures that can be taken for elders to be healthy, independent, and self-sufficient. I will conclude by saying that adding years to life is progress. Adding health, dignity, and care to those years is our responsibility. I wish this program a great success and hope that today's discussion contributes meaningfully to shaping a responsible and holistic approach to geriatric care. Thank you and Jai Hind.
Thank you very much indeed, Mr. Rajput, for setting the tone for today's deliberations and for reminding us that wellness is not merely the absence of disease, but a lifelong pursuit of balance and purpose. And now, our first special address will be delivered by one of India's foremost pioneers in geriatric medicine, Dr. A.B. Day, founder and former HOD Department of Geriatric Medicine, All India Institute of Medical Sciences, New Delhi, and also the chairperson of Geriatric Medicine, Artemis Hospital, Gurugram. Dr. Day's visionary leadership has played a defining role in establishing geriatric medicine as a specialized discipline in India. And it is now my privilege to invite Dr. Day to kindly address the gathering. Let's put our hands together to welcome sir.
Dignitaries on the dais, ladies and gentlemen, good morning. Visionary or not, I don't know, but I was given a task of developing geriatric medicine after being trained by Commonwealth Fellowship by Government of India. I've just tried to do that. In the process, understood and felt the process of aging in my patient population as in my body also. So we're trying to establish geriatric medicine 3 decades back. People would ask me, what do you do in geriatrics? I told I don't know exactly what we are doing in geriatrics, but over the period, as we started seeing more and more frail and sick patients, I understood that the undergraduate training or postgraduate training that I had is not good enough, because probably how the body reacts at the age of 100 years to antibiotics or illnesses or painful conditions, it's very difficult to conceptualize from the training I had in my undergraduate or postgraduate days. But one thing that remained constant, as I was taught by my teachers during my post-graduation, they were asking how are you feeling to the patient, and if they say that patient says that I am feeling good or there is a sense of well-being, then I was told that my teachers would tell me that okay, your drugs or your treatment is working, that's why the patient is feeling better. So when I became a consultant, resident and then a consultant, I understood that probably that's one of the single most important parameter to ask a patient, how are you feeling today, good, bad, as good as yesterday or as bad as yesterday or feeling better. Probably the most important biomarker in medical science that the patient is feeling better, the sense of well-being. But beyond that, the current concept of wellness, which is about 30-40 years of concept that look individuals in a state of wellness beyond diseases and disabilities, is somehow it is emerging. It started getting conceptualized and then getting defined as to what are the components, and multifactorial issues are involved, starting from physical, mental health and emotional support, money in pocket and connectivity and many other things. Last 3 decades, World Health Organization, whom I owe many of my career development to WHO, that started with a concept of independence, autonomy in 1993-94 to active aging, and now at the concept of healthy aging. So, if you add healthy and aging, this is a kind of a contradictory term. One cannot be healthy and aged as well. From the day 1 of birth, as we start aging, the infant develops changes in the biological system, so one cannot be healthy as well as aged. That's what generally we feel. But then WHO told, no, do not look at it that way, that you have your illnesses, you have your osteoarthritis, your prostate, your lung problem, a little bit of forgetfulness, but still one can be healthy by feeling that one is able to do whatever one always wanted to do, or the things that I liked, I am able to do it. So I am healthy, quite all right. So these concepts are emerging concepts. It's great that this organization is looking beyond illness to going to wellness. So wellness, well-being, getting out of illness, these are all important concepts in modern medicine, where we look at technology to sort out many of the issues, and technology is emerging every day. And we are now, if one is not digitally connected, probably one is out of circulation altogether, in health sciences also, in health sector also. So it's a great time to be practicing medicine. When I was a postgraduate, chest X-ray was the only imaging investigation. Now one can look at the inside of a cell through imaging processes and understand what's the problem or what's the good or bad thing in the body is. So it's a great time to practice medicine, evolving from nothing to virtually everything, and you do not know what is the end of it. People are worried. Our budget was about AI and protection from AI, but we in medicine probably some branches of medicine are probably greater threat of AI driven assault on them rather than people like me doing geriatric medicine. What the AI will do to me? Nothing. Older patients will be there, they will be happy to talk to me. I hold their hand and then speak to them, talk about their family, they will always be happy and feel well. I wish this meeting a great success. I'll try to learn from other speakers as to what they think of wellness in medicine at this point of time. Thank you.
Thank you very much indeed, Dr. Dey, for your insightful perspective on integrating clinical excellence and compassionate elder care. And ladies and gentlemen, our next special address will focus on the vital intersection of neurological health, mental well-being and aging. And it is now my honor to invite Dr. Rajinder K. Dhameja, member of the Advisory Council, Illness to Wellness Foundation and Director of the Institute of Human Behavior and Life Sciences, Government of NCT of Delhi. Let's welcome Sir with a huge round of applause.
Namaskar, good morning to all of you, respected dignitaries on the dais, Mr. Rajesh Bhushan ji, Professor Ganguly, Professor Dey, Professor Arun Agarwal, esteemed colleagues, delegates, ladies and gentlemen. Good morning to all of you. At the outset, I must express my gratitude to Anil Rajput ji for organizing this conference and inviting us to learn and to share our experiences in the care of geriatrics population. I am a geriatric neurologist by training. There are very few geriatric neurologists in the country, probably the only one from abroad, and I wear many hats. Apart from a clinician, which I care for my patients every day in and out, and I also head one of the largest neuropsychiatric hospital in the country, catering to 2,500 patients every day in the outpatient clinic, and many of them are over the age of 60 years. We also run a DM course in geriatric mental health, which is run in 3 places in the country, one in NIMHAS, Bangalore, one in Lucknow, and one coming up in IBHAS, New Delhi. So this is indeed an honor for me to stand here and speak on one of the most important topics and very close to my heart, which is in this rapidly changing world, the population is aging because thanks to the public health, thanks to nutrition, thanks to the medical advancement, that more and more people are living over the age of 60 and 65s, and in this age group, citing figures from 10% to 20% in next 10 years. Having said that, this is not something which is, the aging is universal and inevitable, but that's not exactly the goal. The goal is to have these added years lived with dignity, healthy, graceful, with pride, with autonomy, and of course with a lot of independence, whether it is mobility or it is cognitive. All these advances in medical science are only applicable when they are when they reach the end user, and that is the most important thing. And I think this budget has brought mental health into prominence. And again, I continue where Mr. Anil Rajput left, that the focus on brain health and the mental health in this budget has led to a new reform-led policy, which will go a long way in having a Viksit Bharat 2047. I also chair the National Task Force on Brain Health from the Government of India, sir. And that task force is mandated to provide the inputs to the policy makers about the importance of mental health and brain health in our population. The old age is just not a number. It is also an important component of experience, seniority, and giving back to the society if we make them healthy and graceful in terms of their autonomy. Apart from treating the chronic disorders like diabetes or hypertension or osteoporosis or falls prevention or cognition, which is most important thing for me, the early recognition, early building up of resilience, whether it is cognitive resilience or building up the capacity, and of course leading to a response and reduction of the morbidity and mortality are the primary objectives of geriatric care, and that is being happening now for many years, and that will continue to happen. In addition to that, we talk about many things, particularly the 4 C's, which I always advocate. That is, one is it should not be episodic care once in a while. It should be continuum of care, which is happening now and which should happen. It's not only continuum of care, it should be community based. It should reach the home of the concerned persons in this age group. It should also be with compassionate, and it should be coordinated efforts. So 4 C's are very important. So it has to be coordinated efforts with all the stakeholders, it has to be community based, it has to be compassionate, and it has to be continuum, not the episodic. All these things are important in our everyday teaching and research, but implementation of these things is very important. We again talk about 5 M's in this age group, whether it is mind with its cognition, the dementia part, or the and the MCI part, or it is the over medication or polypharmacy, or it is the comorbid conditions, many of the conditions happening together in this age group, or it is the mobility, which is the again independence living or and prevention of falls and other things because of the weak bones. So that is something, again 5 M's, whether it is mobility, medications, memory, all these things together, and what matters most is the autonomy and dignity. So all these 5 M's are again important, and of course if we have to have a graceful and healthy aging, we have to practice lifestyle, which is very, very important for maintaining this healthy aging, which is again many people talk about many S, whether it is salt reduction, or it is sweets reduction, or it is spirits, no alcohol, or it is smoking, no smoking, or it is stress, no stress, and again sedentary lifestyle. So all these S has to be taken care if you want to really have a graceful and healthy aging, and that is something very important for all of us. Talking about the emotional and mental health, again, that is something very important. Many of the elderly living lonely, with the family system being now converted into a nuclear family system, parents living here and children living abroad. So again, loneliness is a very big risk factor for developing dementia also. So we has to have a social support and social cognition or a cognitive support, which is very important, whether you are connecting to the family members or grandchildren, or you are learning a new language, or you are learning a new music, or you are learning or keeping sudokus and crosswords, and all these brain exercises are very important in terms of maintaining your healthy cognition. So that is where we stress upon and we pay emphasis on these things. Lastly, I just want to conclude that looking after these individuals is not a luxury. Geriatric care is not a luxury. It is a necessity in these times, and we have to have the systems in place, the policies in place, which look after these individuals. And let us not make an opinion that the old age or people living elderly are forgotten or for weak. We have to ensure that these added years of life are lived with autonomy, dignity, and with pride. That is something very important. With these remarks, thanks again for having me here and interacting with you. I'm looking forward to have the deliberations in these 3 sessions coming up, and I wish all the best. Thank you.
Thank you, Dr. Dhamija, for underscoring the importance of mental health and neurocare as an integral pillar of gracefully aging. And our next special address will be delivered by a distinguished scientist and public health leader who has shaped India's biomedical research ecosystem. We welcome Professor Nirmal Kumar Ganguly, former Director General, Indian Council of Medical Research and member Governing Council of Illness to Wellness Foundation. I request Professor Ganguly to kindly address the August House. Let's put our hands together to welcome sir.
Thank you, Mr. Rajput, and Mr. Rajesh Bhushan, Dr. Day, Dr. Agarwal, Dr. Dhamija, and many friends sitting in the audience. Actually, I will go with the hopeful kind of comments. In my opinion, age is really a number. Your biological age is what is very, very important. And it's in your hand what kind of biological age you are going to have. Like, I'm perhaps the most aged person in this audience. I've worked from 8 o'clock to 6 o'clock, create my own jobs, don't ask for a beg for a job, and happy contributing both scientifically as well as for others. And I seek out, because one of the points which was spoken was the loneliness and isolation, but I seek out the youngsters, take them out for lunch and dinner and listen to them, and my age changes and my mental health changes also along with them. So it is exactly what you do with yourself. Some of the things which happens, which we had talked about, that there is a problem of dementia of certain amount for everyone, and everyone who is aging. So mental exercise, continuously reading something, continuously exercising your brain is an important part. The other part is this, that everyone in India, about 70% of people have a vision problem. Like yesterday, my flight arrived at 2 o'clock in the night and I forgot my specs in the plane. And today I'm totally blind, can't see, and taking help of the ladies around me to read for me what I'm looking at this. Dr. Agarwal is sitting, the hearing loss is another major problem. The fall is one of the the disbalance and fall is one of the biggest problem in the people. And the organ damages because of diabetes, hypertension, and majority of other cardiovascular metabolic disorders is again something which you have to cope with as you grow old. So what do we do for all of these? And these days the majority of the clinics around the world is being called longevity clinic. That how do we enhance the age? And when I was in the school, the average longevity in India was 45. It is more than 70 today. Even with the social disparity, which we have, very poor, very rich, and people who have a lot of money in their pocket. But this actually brings in huge number of social and emotional issues. So what actually we need to do, we need to teach people that our aging starts from when we are in mother's womb. And with the mother's nutrition, with challenging sometimes the substance abuses and other, the child becomes vulnerable and ages fast and gets many of the diseases like diabetes, etc., which ultimately make them vulnerable, and obesity is another very major issue. So one of the things which we do when we grow old, our intestinal system, which has a neurological system which maintains the mobility, changes, and you have constipation, and you have inflammation in the body, and you have breaking down of your muscles and other things. So when a subject comes, one of the major things is to provide them an anti-inflammatory diet, which could be designed now with the metabolomes, which could be designed now for the individual person. And Indo-Mediterranean diet is one of the best diet which could be given. And the second thing, that dementia could also be helped tremendously these days. There are a lot of interventions which, when you could detect dementia early and later on help them to get that. Then another thing which is there is the energy deficit, and now there is an intervention known as the NAD. You inject NAD, which is a source of energy, and the energy deficit is also taken care of. One of the major thing in the aging, one of the major challenges is our microbiomes. Our microbiome diversity goes, we have dysbiosis, and nothing actually works. Everything is controlled by immune system, our metabolism, everything is controlled by our microbiome. So giving the microbiome through the FMT or a designer oral microbiome enhances the diversity, and the person becomes quite okay. Finally, there is another intervention. One of the major thing, and many of those who are centenarians suffer from this, that they suffer from the frailty. Dr. They passingly mentioned it. And the frailty, nothing works in the body, and people die in 3 to 6 months. There are 20 very major programs which are going on around the globe, in which the mesenchymal stem cells are given for the frailty, and there is a huge amount of improvement. It is not sarcopenia. Sarcopenia, it is something which actually completely destroys the person. So you could enhance the quality of life of an aging person who has not taken care of their health. And now with the Ozempic and many other things, the obesity can also be helped, of course, with a good, healthy exercise. Finally, in the concluding comments, I will like to say that a recent research has shown that the persons with the 60 years of age have the best productivity. Their research becomes better, their contributions become better. So please, one of the policies make that don't retire people when they reach 60. Let them work, let them contribute in whatever way they could. The other thing, we need to change our society. 5 of my cousins, Mr. Rajput mentioned it, 5 of my cousins were cremated by not their children, by people in the community because they couldn't reach or they didn't come or whatever happened over there. So our society which is changing, which Mr. Rajput mentioned, I don't know how to really engineer the society. The social scientists, mental health guys and others should be brought into the system to really change that. I have seen two communities, like many of my Japanese colleagues who were working with that, they took a voluntary retirement to be with their parents, to look after their parents. And that was something which I was surprised. And one of the best healthcare for the elderly is in Japan. The other country which is very nice is there, that is Thailand. In Thailand, around one third to about half of the girls don't get married. In Japan also. And please value your girl child, because they will look after you. They actually look after their older parents. And the communities have been structured to look after their elderly population. So I don't know how do we change Indian society. It is a horrendous society which we are building. Somehow or other, our old culture, our old value systems have disappeared. So we need to build our society. That should be one of the best things which we could do. Thank you for this opportunity to come here.
Thank you very much indeed, Professor Ganguly, for your valuable insights on evidence-based policy and research-led approaches to healthy aging. And ladies and gentlemen, for the keynote address, we are honored to have with us a senior policy architect who has played a central role in shaping India's public health framework, Mr. Rajesh Bhushan, former Secretary to the Government of India in the Ministry of Health and Family Welfare and Chairperson of the Governing Council of Illness to Wellness Foundation. I now request Mr. Bhushanji to kindly deliver the keynote address. Let's once again put our hands together to welcome sir.
Mr. Anil Rajput, Dr. A.B. Day, Professor Dr. Rajendra K. Dhamija, Professor Nirmal Kumar Ganguly. Sir, we first interacted when I was a young director in the Union Ministry of Health, Government of India. This was early 2000. You were very young. Then we interacted when I became Health Secretary in 2020 and remained Health Secretary till 2023. You were still as young as the early 2000, and today we are interacting again, and I must commend you for your ability to remain young, remain vivacious, remain outgoing, and this is something that we must learn from him. Dr. Arun Agarwal, ladies and gentlemen, this is indeed a pleasure to be part of this interaction today. Geriatric medicine and geriatric care is a major area which must engage the attention of not only the policymakers at the union government level, that is Government of India, and the state government's level. It should also engage the attention of all health administrators and all doctors, because this has remained, like mental health, this has remained a largely ignored area. I remember with IAS officers, we keep on flitting between the state government to which we are allocated and the Government of India. I remember my first phase in Government of India from 2000 to 2007, then I went back to the state government, then came back again to Government of India around 2012. That was the time, Dr. Day, when you were setting up the Department of Geriatric Medicine in AIIMS, and they started giving MD and PhD in geriatric medicine. Now, this is one area. Today, I think most of you know that AIIMS New Delhi has a National Center for Aging. So, it's a one-stop shop for all senior citizens and their sort of ailments, right from OPD to IPD to ICU to other assistive medical services, they get at one place. But for a country of 1.45 billion population, which has a rapidly increasing elderly population, how many such integrated geriatric centers can you provide? So while AIIMS National Center for Aging remains a center of excellence, what we need to do is to provide geriatric care right from home-based care to district-level medical care. So the question would be, what is the government doing about it? Or what are the non-governmental organizations doing about it? Or what the private sector is doing about it? Because private sector, because of the very nature of the way it operates, is limited to tier 1 towns. So geriatric care provided by private sector is also tier 1 towns. Of late, it has started going to tier 2 towns because there suddenly the market has started booming. But what about district headquarters? India has more than 470 districts. अगर जिले के लेवल पर आप एल्डरली लोगों को स्वास्थ्य सुविधाएं नहीं दे पा रहे हैं, that is a big challenge. And we must put our minds together to see how that challenge can be met. When I say that on one end of the spectrum you have home-based care for the elderly, you don't need doctors for that, you don't even need nurses for it. You see, these BSc nurses, they are not required. What is required are young, dedicated people, boys and girls, who are trained in home-based care for the elderly. So what are we doing about that? The budget talks of, this budget particularly talks of giving an incentive there, which will have to be then done jointly by multiple ministries of the government, Ministry of Skill Development, Ministry of Social Justice and Empowerment, and the Health Ministry would come together, formulate programs and start training that. Because some of these problems need not go to a tertiary facility at all. Basic problems of the elderly can be resolved at the home itself, provided they have trained caregivers. So that is one area we need to focus. Then we need to look at, can we repurpose and reorient our general medicine doctors at the district headquarter level, in district hospitals, in some kind of geriatric care. Because courses are limited. MD और PhD या पोस्ट ग्रेजुएट डिप्लोमा कम ही लोग कर पाएंगे, या करने में अभी शायद इच्छुक नहीं हैं, दे आर नॉट इंटरेस्टेड, या इंस्टीट्यूशंस लिमिटेड हैं विच आर ऑफरिंग सच कोर्सेज. So how do you bridge that gap till such time that such institutions and such courses multiply? That can be done only by repurposing the existing general medicine human resource. So that is another area which we need to address. Equally important is the mental and social aspect of the care of the elderly. In India, as our economy booms, we become the fourth largest. Eventually, in near future, we will become the third largest economy globally. Our family sizes are reducing. We are progressing towards nuclear families. In nuclear families, there are very little interaction and support for each other because everyone is working, they have very little time together. Professional kids, boys and girls, are moving out and settling either within the country at distant places or outside the country, leaving their parents behind. So all this creates the problem of care for the elderly, the social support, the emotional support part of it. Because the elderly, as you grow up in years, you realize that your close circle, your friends with whom you socialized, they are slowly disappearing. They are physically disappearing. So what do? You do not have your children to interact with. Dr. Ganguly did refer to people in Japan taking voluntary retirement and looking after their parents. This is an example we should learn from. In fact, I was saying that there are two countries that we must learn from as far as elderly care is concerned. One is South Korea, other is Japan, because they have actually done good work in this area. So these are some of the challenges that we face. In the final analysis, if we could bring at one place, as has been done in National Center for Aging, people dealing with general health, people dealing with muscular health, people dealing with neurological health, people dealing with rehabilitative health together, only then we would be able to provide health care in an integrated manner to the elderly of our country, which must be our foremost priority. With these words, I wish this interaction succeeds and brings successful results, and I wish all of you well. Thank you.
Thank you very much indeed, sir, for articulating a clear roadmap on how policy systems and partnerships can collectively strengthen geriatric care in India. And now, ladies and gentlemen, to formally conclude the inaugural session, I invite Dr. Arun Agarwal, Chair FICCI Task Force on Active and Healthy Aging and former Additional Director General of Health Services, Government of India, and Medical Advisor, Apollo Hospitals Group.
Thank you. Good morning. Our esteemed, respected Dr. N.K. Ganguly sir, Shri Rajesh Bhushan sahab, Rajput ji, my colleague Dr. Dhameja, Dr. Day, all the distinguished audience in front of me. Well, we had a very good start for today's activity. The topic which is perhaps in the heart of all of us, especially for those who are already into this age group. मैं हमेशा यही सोचता हूँ कि जब भी हम कोई चीज़, हमने जो राजपूत साहब आपने जो टॉपिक रखा है वो हेल्दी भी रखा है और ग्रेसफुल एजिंग रखा है, तो ग्रेसफुल एज जो है ना ये बड़े इम्पोर्टेंट पॉइंट है सर। अब मैं जब देखता हूँ तो मेरे सामने कुछ सक्सेस स्टोरीज नज़र आती हैं। एक तो मेरे रेस्पेक्टेड डॉक्टर एन.के. गांगुली साहब को देख लेते तो एक सक्सेस स्टोरी सामने आ जाती है। I closely interact with him because he is part of Apollo group also, and whenever I interact him, सर मैं बता सकता हूँ आपकी एज करीब 84-85 के करीब, देखिए मैंने ठीक कहा। और जहाँ भी डिस्कशन पे इनके साथ बैठ जाइए, ऐसा हो नहीं सकता कि सर को कोई चीज़ ऐसी ना मालूम हो। हम लोग ढूंढते रह जाते हैं, सर के पास पूरा इंफॉर्मेशन है। इनसे मिलने की कोशिश कीजिए, इनसे मिलने की कोशिश कीजिए तो मालूम चला कि सर आज लंदन में गए हैं, वहाँ से यूएस जाएंगे और उसके बाद रात को 2 बजे आएंगे और कल भी रात को 2 बजे आए। कोई कह सकता है 84 प्लस आदमी, आई अप्रिशिएट सर, मैं नज़र नहीं लगा रहा, मैं कह रहा हूँ भगवान करे 100 साल तक ऐसा ही चले। दूसरा एग्जाम्पल, एक तो सर का दिया, कुछ महीने पहले हमने पढ़ा एक फौजा सिंह साहब जो इंडियन बॉर्न ब्रिटिश बन गए और उसके बाद उन्होंने अपनी लाइफ की 89 इयर्स पे उन्होंने मैराथन दौड़ा और वी लॉस्ट हिम लास्ट जून एट द एज ऑफ 114। देखिए ये क्या एग्जाम्पल है हमारे सामने। तो इसका मतलब हमने whatever we heard from our experts, whether it is the development of geriatric medicine, all the steps we have to take. I fully agree, Rajesh Bhushan ji, Dr. Day तो geriatric सब्जेक्ट को डेवलप करने के लिए एक मोस्ट रिस्पॉन्सिबल पर्सन है कंट्री में। हमारे मेडिकल एजुकेशन सिस्टम में राइट फ्रॉम MBBS टू MD मेडिसिन, अब एवरीबडी कैन नॉट बिकम जेरियाट्रिक मेडिसिन एक्सपर्ट. इट इज़ इंडिया. इंडिया में तो हमको इतना राइट फ्रॉम नॉर्थ टू साउथ, ईस्ट टू वेस्ट देखना है, 145 करोड़ पॉपुलेशन को देखना है. तो इसका मतलब यह है कि मैं ये जरूर चाहूँगा एज मेडिकल एजुकेशनिस्ट, डीन मैम से, कि हम जरूर जेरियाट्रिक मेडिसिन का एक शॉर्ट डेज आप इस पे जरूर कमेंट करेंगे कि एक 3 महीने का या 6 महीने की फेलोशिप हर बंदे को दें ताकि उसको जेरियाट्रिक केयर करने का बेसिक फंडा क्लियर हो जाए. अब हमारे सामने सवाल ये उठता है कि जब हम मेडिसिन की बात करते हैं तो मेडिकल केयर, आई एम सो हैप्पी दैट लास्ट 3 days हैज बीन सो गुड टू अस. वी हर्ड सच वंडरफुल न्यूज़ फॉर द बजट. आज सुबह जब मैं पेपर पढ़ रहा था तो टाइम्स ऑफ इंडिया किसी ने पढ़ा था सर. टाइम्स ऑफ इंडिया में एक काफ़ी अच्छी हेडलाइंस है. और इंसिडेंटली मैं मन से कह रहा हूँ, कल शाम को मैं सोच रहा था राजेश भूषण जी कि यदि मेरे मन में इच्छा है कि मैं 150 ईयर्स जीना चाहता हूँ, क्या जी सकता हूँ? उसका जवाब आज पेपर में आ गया. उसने कहा साहब देखिए, आप 150 ईयर्स जिए, 100 जिए, जेनेटिकली आपका बॉडी होनी चाहिए और दूसरा एनवायरनमेंट होना चाहिए. तो जेनेटिक्स मैं नहीं चाहता कि हम में से कोई भी कहेगा कि बियॉन्ड ए पर्टिकुलर एज, फिर वो ग्रेसफुल एजिंग कहाँ रह जाएगी. हमको तो हेल्दी भी चाहिए, ग्रेसफुल एजिंग भी चाहिए. तो वो जो ग्रेसफुल वर्ड है, अभी कुछ महीने पहले फिक्की की तरफ से मैं और मेरी कोलीग मालती जी, प्लीज़ आप खड़े हो जाइए, ये बहुत मेहनत करके वो पेपर बना है. फिक्की ने एक पेपर रिलीज किया है और ये है जीवत शरद शतम, अनलॉकिंग द लॉन्जिविटी डिविडेंड. एंड इफ यू वांट टू रीड इट, आई एम श्योर यू विल गेट इट ऑन द वेबसाइट ऑफ फिक्की. एंड यहाँ सरिता जी हैं, मैं उनसे भी कहूँगा कि उसके बारे में और इन्फॉर्मेशन जो भी तय दे दें. वेदास में लिखा है कि हमको 100 शरद ऋतु जीने को दिया जाए. तो 100 शरद ऋतु यानी कि तब से 100 ईयर्स का एक मार्क हमारे सामने है. डॉक्टर गांगुली बोले सर कि जब हमसे आप एज में बड़े हैं, लेकिन थोड़े ही बड़े हैं, ज़्यादा नहीं, जब से हमने देखा तो हमारी लॉन्गिविटी 47 या कुछ इस टाइप की थी. आज हम 70 प्लस हैं. हम उम्मीद करेंगे हम इसको बढ़ाएं, 80 तक ले जाएं, 85 तक ले जाएं. वो अपनी जगह है, लेकिन एक विधि ने जो विधान बनाया है वो हमको 100 ईयर्स का दिया हुआ है हमारे एंशिएंट लिटरेचर के अनुसार. तो हम जरूर उसको एक हेल्दी से हेल्दी एजिंग बनाएं, लेकिन हमने भी अपने पेपर में हेल्दी के साथ एक्टिव एजिंग जरूर, भगवान करे हम लास्ट डे तक एक्टिव रहें. That is the must aim, because that is the most satisfying survival. Thank you very much, Rajput Saab, for giving me this. And it's a wonderful scientific feast we are going to have, and I'm sure the outcome will be very useful. Thank you.
Thank you, Dr. Agarwal, and ladies and gentlemen. With that, we come to the conclusion of a very meaningful inaugural session, and I would request Mr. Anil Rajput to kindly do the honors of presenting a small token of gratitude and appreciation to all our dignitaries. We begin with honoring Mr. Rajesh Bhushan. He is the former Secretary, Ministry of Health and Family Welfare of Government of India and Chairperson, Governing Council, Illness to Wellness Foundation. We present to Professor Nirmal Kumar Ganguly. Thank you, sir, for being here with us. Former Director General, ICMR, and member Governing Council, Illness to Wellness Foundation. Dr. Rajender K. Dhamija, Member Advisory Council, Illness to Wellness Foundation, and also Director, Institute of Human Behavior, Allied Sciences, Government of NCT of Delhi. Dr. A.B. Day, Founder and former HOD, Department of Geriatric Medicine, All India Institute of Medical Sciences. And also to Dr. Arun Agarwal, Chair, FICCI Task Force on Active and Healthy Aging. Thank you, sir. And may I request all our dignitaries to kindly come forward for a group photograph. I would request all our guests to kindly remain seated as we will straight away move into the next session, which is our first panel discussion session on preventive and care strategies for dementia and Alzheimer's disease in the elderly. Thank you very much indeed. You may kindly take your seats in the front. We would request just a few minutes to do up the top table for the next session. Kindly remain seated. Once again requesting for all mobile phones to be kept onto silent mode. Take up a session that lies at the very heart of the healthy and graceful aging, the prevention, early detection and compassionate management of dementia and Alzheimer's disease. This session will examine early detection of cognitive decline, brain-healthy lifestyles, caregiver support, safe living environment for Alzheimer's, genetic risk awareness, and management of behavioral systems. And to guide this important discussion, we have with us a distinguished moderator and eminent panel of experts. May I invite on stage our distinguished moderator, Professor Dr. Prasun Chatterjee, former Professor, Department of Geriatric Medicine, National Center for Aging, AIIMS, New Delhi. Let's put our hands together to welcome Sir on the dais. He is, and also inviting our eminent panelists, Dr. Prashant Singh Walia, Senior Consultant, Geriatric and Internal Medicine, Primus Super Speciality Hospital. Warm welcome, sir. Inviting Ms. Malti Jaiswal, Co-Chairperson, FICCI Task Force on Active and Healthy Aging and Founder, Inspiring Seniors Foundation. Warm welcome, ma'am. Inviting Dr. Sumit Mrig, Director, Unit Head, ENT Max Smart Saket, and Dr. Vijay Kumar, Senior Consultant, Department of Geriatric Medicine, Sardar Health City. Ladies and gentlemen, our distinguished moderator, Professor Chatterjee, brings with him rich academic and clinical experience in geriatric medicine with a special focus on comprehensive elderly care and age-related cognitive disorders. I would request Professor Prasun Chatterjee to formally commence the proceedings of this session. I would request you, sir, we have only 30 minutes left for the proceedings of the session. And ladies and gentlemen, especially for our distinguished audience, if time permits, we will take up questions. Otherwise, you can link up and on one-to-one basis with all our distinguished dignitaries during the lunchtime. Over to you, sir.
Thank you, madam. And I welcome all of you in this session. I am Dr. Prasun Chatterjee, and thanks to the organizer for giving me this opportunity. The topic is, may sounds who are comparatively younger, that this topic is of aging population, but believe me, whoever is here, all of us are going towards that problem, that is dementia. And if I tell you the prevalence with age, the prevalence of dementia increases exponentially. So I'll give a very small demographic data. When you are 60, your chance to develop dementia is like 1 to 2% as per the demography and your educational status. And then when you are 65 and above, it becomes 2%, 2 to 3%. Then you become 70 plus, it becomes 3 to 4%. Suddenly, when you are 75 plus, it jumped to 6 to 8% to 12%. And when you are 80 plus, it again jumped to 15 to 20%. And someone who is 80 plus, or 85 plus to be very precisely, the chances to develop dementia is anything between 15 to 40%. So there is a chance that 1 in 3 person who are 80 plus, they have a chance to develop dementia. And let me again stress the statement that all of us says that there is a demographic shift. 60 plus is going very fast, but actually 80 plus is the fastest growing population. So dementia prevalence does not increases with aging, it explodes. So, and unfortunately, the process has started much early, even at the age of 30 or 40. So there are n number of studies which shows even 40 years of age, your gray matter is gradually shrinking. So I understand there are a lot of people who are in their 30s and 40s, don't be happy, the process has been started. But the good news is, can we prevent it? Just like the previous discussion, we have people like Professor N.K. Ganguly, we call them as super ager, whose brain function are those who are 80 plus, but their brain functions are as good as 50 plus. So they could able to slow the process of aging. So along with geriatric medicine, I am into a longevity space, which is more for life course perspective. So I will highlight here. So जैसे कि अग्रवाल सर ने भी कहा, लंबा जीने से मतलब नहीं है सिर्फ, ग्रेसफुल भी जीना है, हेल्दी जीना है, right? Physically, mentally, socially, we have to be active and independent till the last breath. That is our hope and purpose. So if you can reduce your speed of aging or biological aging, which we speak, because your cell is aging differently, not like your chronological aging. So it may happen that Ganguly sir's chronological age may be 84 plus, but his biological aging may be 75. Even there are a lot of centenarian, I have at least 20 odd 100 plus patient, jinka memory probably mere se bhi behtar hai. So if you can reduce your cellular aging, biological aging, your brain aging by 5 years, you may get 20 to 30 years extra graceful aging, what Dr. Agarwal sir just mentioned. So why not to try that? So the whole discussion is about prevention in clinical practice, in community, in day-to-day activity, as much we can do. So I will start with my junior colleague, once upon a time my student Dr. Bijay, because he's one of my direct student, now he is my colleague. That Bijay is practicing geriatric medicine. So Bijay I'll request Bijay, if you can highlight us, what are the preventable risk factor, 3 or 4, because as per Lancet Commission, there are around 12 risk factor. We should restrict on clinical risk factor as a doctor panel. That what are the clinical risk factor, 3 or 4 you consider as very, very crucial, which we should treat so that we can prevent dementia. And also I'll put next question together because organizer told we have very less time. In 5 minutes time, you also tell us what do you feel that in your clinical practice, can we routinely screen through objective questionnaire like MMSE or MOCA for all 60 plus who are coming to your clinic about their memory? Bijay, over to you.
Thank you, sir. Thank you. First of all, I would like to thank the organizers for organizing such a beautiful conference here, and it's the as a society we are aging, as Dr. Prasun Chatterjee has already mentioned that there is silver tsunami we are expecting. Now this young India will be old India or senior India in few years. So also the government is also realizing this, and we have been trained under Dr. Prasun Chatterjee and Dr. A.B. Day. So this department was started with this feeling also that we will need the geriatric physicians. We will need special physicians for the senior citizens. So in our country, like we live in India and Bharat, there are two stratas. So if we are talking about the preventable factors, most common preventable things are diabetes and hypertension. These non-communicable diseases are the major factors which are leading to complications like stroke and then the dementia also. These are risk factor for Alzheimer's also. So these two diseases are the most common, and I have seen in society people are very ignorant about it. उनको 200 तक भी बीपी होता है तो वो सोचते हैं कि कोई बात नहीं, सिर्फ आज दवाई ले लेते हैं, आज सिर दर्द हो रहा है, तो वो उसको सीरियसली लेते ही नहीं है. And I have seen not even like that illiterate people are doing that. Even learned people who are engineers in the Microsoft or Google, they are ignoring their health, and it's leading to kidney failures. And later on, they will not realize that this will, if they will live up to 70s, then they will definitely develop these dementia and the neurodegenerative disorders. Likewise, diabetes also. People in our country mostly inclined towards Ayurvedic treatments, and they just stop the allopathic treatment and go for Ayurveda treatment, and they don't even follow their blood sugar charts and HbA1c. So most commonly I have seen in the practice that even people are not taking these simple preventable diseases treatment. This is leading cause as per the Lancet Commission also. And air pollution, all these are beyond our control, but what is in our control is these diseases which can be controlled. And like in the about second question, we as a physician or as a geriatrician, family physicians, we are not practicing the habit of assessing their mental status, their cognitive status. These scales are lengthy. These scales, like directly we cannot apply to every patient in our routine practice, because it may take 30 minutes to 45 minutes per patient. But we have mini-cog and other screening tools which can be applied, and if it's showing some problem, then we have to go for detailed assessment in our OPDs through psychologist and all. Thank you, sir.
Thank you, Dr. Bijay, for your elaborate presentation. Here I would like to mention, because I understand there are a lot of common people are also there. You must try at your home also, even asking your seniors who are at home that whether you feel that you are forgetting things. And you must observe, remember, no amount of forgetfulness is a normal phenomenon. This myth that Umar hua hai thoda to bhulega is absolutely nonsense. It is a very, very old school of thought. You may have heard this from your health professional also. Then also you have to understand this is absolutely incorrect. Any form of forgetfulness at any age, you must visit a doctor and stress that, doctor, please do a detailed assessment for me by neuropsychologist or any specialty whatsoever. But you have to seek for it. Forgetfulness can be in other form also. It can be forgetting name, forgetting immediate memory, and someone who were doing lot of things together we call as executive functioning. Now he is missing few things. It can be problem in your social cognition, because social cognition is a new domain. Someone पहले अच्छे करते थे, सोसाइटी में जाके अच्छे मिलते थे, पार्क में जाते थे, वो suddenly कम कर दिया. That can be also an early sign. One important, even we have taken this as a longevity marker now, social isolation, which is a very, very important risk factor for dementia. So please, if you have anybody near and dear one in your community, please you just look for it and take him or her to the doctor. Please help him, because the good news is earlier we pick the diagnosis, we have much chance to reverse or at least halt the process. Now I will ask Dr. Sumit, a renowned ENT surgeon. Dr. Sumit, as per Lancet Commission, we know that hearing impairment is one of the definite risk factor for dementia, which is a very, very ignored things in 60 plus. What is your opinion, and I'll say what is your experience when you deal with 60 plus, how much they use? Because I know my father doesn't use, even if I have requested 100 times. And what is the implication for this, and how are you going to recommend any 60 plus who are here or near, and how to go about it?
Thank you, Dr. Prasoon. My colleagues on the dais, thank you first of all organizers for giving me an opportunity to be here, especially my teacher, mentor, Dr. Professor Arun Agarwal sir. I have been trained under him at Maulana Azad, and what a moment for me that he's sitting as an expert here, and I am here because of him. I am an ENT, I'm a cochlear implant surgeon, and along with sir, I'm the founder member who started the implant program at Maulana Azad Medical College. By default of his passion in hearing loss, he is the person who represents Southeast Asia to WHO. And I have been fortunate enough to fall into his footsteps that I am treating hearing loss across the world. So let me start that national program for blindness started in our country in 1976. I was not even born that time. But if you see the National Program for Prevention and Control of Deafness, started in 2007, I still remember, I was at Maulana Azad under him doing my post-graduation, when Shravan Shakti Abhiyan was launched by the Delhi government. I would say that we have been very unfortunate that till now, we have not laid our hands and our importance on deafness, hearing loss. Ye to chalta hai. I think it's an attitude which works. And if we look at the WHO report, which was released last year, by 2050, 1/3 of the world population is going to suffer from some kind of hearing impairment. Now, what we are talking today here is a very valid point, is about dementia, about Alzheimer's, the progression which is going to affect the cognitive function of a person, forgetfulness. I'm sure, the previous members on the dais, all of them are exempted. They are going to live long, 100 years, and trust me, their memory, I see Dr. Arun Agarwal, sir, he doesn't forget everything, I don't know what food they eat, what they do. He is not wearing a hearing aid. I saw Professor Ganguly, he is fit at 84. So the people who need to be scared are all of us sitting here, I'm telling you. Not these guys. So, I think what we are focusing is dementia, Alzheimer's, but what we are neglecting is that what is the root cause of it. See, all of us have to age gracefully, but what we are not realizing that the current generation from the age of 35, 40, we are seeing hearing loss across age groups because of pollution, diet, noise pollutions, because of traffic, airports, mobile phones. Now, what Dr. Professor Prasoon mentioned, if you see the global burden, currently 55 million people suffer from dementia currently in 2020, which is going to reach 78 million by 2050. Now, every 10 decibel loss of hearing is going to add 16% increase in the chances of developing dementia in these people. Now, there is a beautiful study by Johns Hopkins which says that as your hearing loss increases from mild to moderate to severe category, the multiplication or the folding of getting dementia goes from 2 times to 3 times to 5 times. In fact, there is an article from JAMA which correlates between the hearing loss detected on pure tone audiogram versus the hazard risk factors for dementia. So there is a hazard risk factor, and they have clearly mentioned that people with untreated hearing loss or without even diagnosing hearing loss had a much higher hazard rate than people who were using hearing aids. Now, this is something which is very important. So that's why there is a need for screening. There is a need for regular audiology checkup. I fail to understand that in our country, we all use electronic devices. We get our iPads, we get our cars examined every year at workshops. But what about us? We are non-materialistic. We are human beings. We only come to get a hearing checkup done when your neighbor is complaining that please lower down the volume of the TV, or your family is complaining. But we don't accept it because acceptance means that we have a fault in us. Of course, we have to age gracefully, but important is half of us sitting here are wearing spectacles because it's a style now. 20 years back, you asked females to wear a spectacle, they would not wear because it was considered a social taboo. Similarly, we are dealing with hearing aids. The first thing a patient will ask us, Doctor Saab, कान में दिखेगी क्या सुनाई की machine? So I think first we have to win within ourselves that we live a quality of life. If we wear hearing aids, we are going to balance our hearing, we are going to hear well, and the hearing decline is going to be much, much slow. I think the change has to be brought, and I'm very glad that these kind of events will bring a change in the society. And to bring this change, I run a trust foundation, Sankalp Trust Foundation. Dr. Arun Agarwal is a trustee with that. The pediatric deafness program has received a lot of importance in the last 30 years, in 1996 when cochlear implants started to happen in India. But the geriatric program is still no one is putting his hands on. In fact, if I see, whenever I get families visiting me at my center, at Max Sake, Dwarka, or at my center, Sankalp ENT Cochlear Implant Center, whenever you advise a family with a son that your father needs a good quality hearing aid device, he always says, sir, we will come back to you. Because they find it difficult to spend that money on their parent, and what the parents do? When they get retired, they transfer all the provident fund into their children's account so that they can have a good life. No, it's your quality of life. You have to ensure you have to stand for yourself. Because no sooner you have hearing loss, you get dementia. When you get dementia, you are useless to the society and to the family. Please don't let yourself be useless, because I believe that aging has to be very gracious. And at this platform, let me tell you that Sankalp Trust Foundation, along with the vision of Dr. Agarwal, me, I would invite stakeholders here to develop a holistic program, and I'm ready to take that challenge, to develop a holistic hearing and rehabilitation program, not only with hearing aids, but patients who need support, financial assistance. Last year, we did about 60 cochlear implant under our trust. Different parts of the country, the deaf children who couldn't afford a costly cochlear implant, the trust funded 50% under the guidance of Dr. Arun Agarwal, and I would like to give that assistance to Geriatric group also.
Thank you, Dr. Sumit. Actually, problem does not end there also, because I am seeing my father. I am, despite the fact that on lighter when I tell, many of you are also daughter-in-law here, must be. So I tell all daughter-in-law that अभी अपने father-in-law या mother-in-law नहीं सुन रहा है, आपको अच्छा लग रहा है शायद, ना सुने तो ठीक है, लेकिन ये ना एक सेकेंड तो ना सुने तो धीरे धीरे क्या होगा, इनको जब डिमेंशिया होगी तो आप ही को ख्याल करना है. So मेरे वाइफ, मैं मेरे पापा के एकदम पीछे पड़ा हूँ. We have given the best of the best machine. The compliance is a big issue, which I think आपको आपके trust से और आपके practice में उसको भी, क्योंकि when they listen from you, because you are the horse here, when they listen from you, they will probably listen to you, sir, not to me.
I will just tell you one thing. It is never the machine, it is the audiologist behind the machine. The biggest problem in our country is that Blinkit provides every service, and I am not surprised when in 5 years from now you can order hearing aids from Blinkit. The problem is not the machine. The problem is what is the right machine which is going to fit your father with the hearing loss. The acceptance rate of hearing aids is so low in our country that people take hearing aids, they spend lakhs of rupees. They will not wear it only for 2 days because it creates so much noise, it creates a kind of a discomfort. Because you need an expert in audiology, you need a surgeon to understand the requirement of a patient for a hearing aid device. The requirements of a vendor with a CEO of a company, or maybe a doctor or a professional or a chartered accountant who has to be at his best to understand and not miss even one word, is very important. And for this, you need a very good diagnostic testing. You need to examine many parameters, and only then you can do a good fitting. Like I tell you, Many of
I
us,
think, Dr. Sumit, we have to go
just
for
last
other.
thing I'll tell you, many of us sitting here wear tailored suits because what the fitting is yours is going to be the best. You will relish it. This is the problem with hearing
No,
aid.
you are right, but partially, elderly psychology is very complex. They are baby boomer. My father say battery cost is too much. I will come to Madam Dr. Malti. What is your opinion about caring for dementia in community? How, other than intergenerational activity, I would like to know, because I also run an NGO, what is your experience that a senior citizen is caring for another senior citizen? 60 plus is caring for 80 plus. And what do you feel also about the caregiver's burden? Because here it's not only the person, his family, his community. We used to say that एक बच्चे को बड़ा करने के लिए पूरा गांव चाहिए, अभी तो ऐसा हालत है एक डिमेंशिया पेशेंट को केयर करने के लिए एक पूरा कम्युनिटी चाहिए. So what is your take, ma'am?
Thank you, Dr. Prasun, and thank you to the organizers for giving me an opportunity. एक मिनट लेते हुए, क्योंकि हम हेल्दी एजिंग की बात करें और सब लोगों के एजिंग हो रहा है, एक बारी उठ के बैठ जाते हैं, जस्ट स्टैंड अप एंड सिट. एक्टिव एजिंग तो ऐसे ही होता है ना, बैठे बैठे नहीं होगा एक्टिव एजिंग. थैंक यू. सो एक्टिव एजिंग जहाँ पे भी है वहाँ पे कर सकते हैं, किसी भी एज स्टेज में कर सकते हैं. ऑप्टिमम हेल्थ को मेंटेन करना है, दैट इज़ व्हाट द टारगेट इज़. So we are talking about healthy longevity. We are all living longer, and you said 60-year-old, 80-year-old को कैसे देख? I'm a 62-year-old person, and working now, entered into the arena of healthy longevity and healthy aging. Every opportunity we create, every awareness we create. Awareness पे हम बहुत काम होना है और हो भी रहा है. But awareness के साथ साथ opportunities, what are the opportunities to stay engaged, have to also be there. And since there are so many doctors here, geriatricians and other specialists, my request to them is, please do include the concept of social prescriptions when you're talking to your patients, whether they are young or old, but particularly for old people, social prescription must be part of the medical fraternities, prescriptions, because coming from you, it would have more impact than any ordinary person telling them कि अच्छा कुछ music सुनिए, अच्छा आप कुछ और करिए. They think, अच्छा ठीक है, ये तो common ही है. But when a doctor says it, it holds some meaning. So social prescription is one thing. So coming back to the main point about community engagement for the seniors and for the caregivers, these are the two questions. I think those were the two questions. So I'll first speak about the seniors themselves. I would say that let's prevent them having dementia should be the first target. I mean, prevention should be happening at all ages, in all stages. When you said that, start young, so that should be starting young. Second, I agree with the doctor that 30 minutes is a very long screening tool. Let us empower community workers and NGOs to carry out screenings. And here again, the role of the doctors comes that they should popularize dementia screening as much as we are popularized, let's say, diabetes screening or a cataract screening or a hypertension. It should become that popular. If we have to stop this bomb from dropping on our country and our economy and our families, we really need to take it to a next level of prevention and detection, and then preventing the gradual fall the patient is going to have. Now, person has become a patient. The community engagement is how do you make the patient remain a person? I think that's the distinction that the community role, the families and communities play. And in the halfway through the healthy, UN decade of healthy aging, we should be really taking at mental health and a cognitive health very, very seriously. Believe you me, in my non-profit, we run programs which help the cognitive and emotional health. But seniors don't realize the importance of those programs. That's okay, that's fine. You spoke about intergenerational, programs. So we run tuition program for underprivileged children. One of the doctors that one of the mentors we have, he said, you should be charging these seniors. Actually, their mental health is improving, not the children who are gaining from these tuitions. So, but the importance of awareness and opportunities is very high. The caregiver load is tremendous. I think their burnout is too much, So the burnout can only be reduced by few ways, like sharing the burden. That I think if beyond the family, the community level, there is sharing of burden, which used to happen earlier. there is, there's some kind of caregiver respite that happens, some kind of an emotional support that happens. And of course, the government should realize the caregiver burden. It's really good that they have come up with, the budget talks about training 150,000 caregivers. But I think caregiving should get special leave, special facilities, special benefits from the government, because caregiving is extremely burning out the person, the families. So these are some of the things that we should be looking at. But of course, I mean, the topic is such that I could go on and on speaking, but my request to everyone sitting here, the active life, active lifestyle, learning something new, and staying connected with your society, with your social network. Fourth is having purpose. One of the things that seniors miss is having purpose. So, it is all our responsibility to create opportunities where they can be purposeful, they can be relevant, and that is all that can be ensured, that can ensure their dignity and autonomy in the later run. Thank you.
Thank you, madam. Now I would request Dr. Prasant, he's an internist and geriatrician. Dr. Prasant, the question is little different for you because we have to complete the flower bus. So can you suggest some of your idea about what should policymaker consider if they are jotting out, there are some plans, some national program also, mental health ke upar, but customized care for dementia. If we consider, what do you feel about the role of doctor, social worker, policymaker, and other stakeholder, and the individual himself also? So what do you, suppose if you get an opportunity, what will be your recommendation to the policymaker, that how should we go about to manage this tsunami?
Thanks, Dr. Prasad, for giving me opportunity. As a clinician in Primus Hospital, we are regularly dealing in geriatrics patients. India is a big country with 1.4 billion people, and it is expected till 2050 we are dealing with 1.17 million people with the dementia problems. This is a huge amount, huge big population. It is of a size of a country, and imagine how difficult it is to deal with such a big population of dementia. We must develop a national program and a strategy to deal with Alzheimer's, dementia, and geriatric problems. Like when you are dealing with such, then prevention is always better than cure. So we should have a three-pronged strategy. One is lifestyle modification. We should we should have a program to deal with the smoking cessation. And smoking brings dementia and geriatric problems. Then we should think about alcohol. We should help the people to relieve from alcohol problems. Then low salt diet. These are the lifestyle modifications. They don't require very trained persons, but the media and the general people can create awareness. Second thing appears to be regarding the secondary prevention. Secondary prevention, here we have to deal with diabetes, hypertension, dyslipidemia, obesity. These things have a lot of role. And if we are dealing successfully with this, many times diagnosis of these diseases takes years. Patient is having diabetes for years, but he is not diagnosed, or nobody is interested sometime in diagnosing itself. Third thing is the tertiary care, like when a person has set in dementia, then how to deal with it. Now, social isolation is a big challenge. It is said that if you have cognitive stimulations through self-help groups, senior people group, and they regularly visit you, or the elderly people going into the park and have a discussion, then this helps. Now who will lead this? Obviously government will lead it. Government makes the policy, and then doctors set the standards, and the community help for its last mile connectivity. The ASHA workers can play a good role. Again, for the diagnosis and early diagnosis of BP, diabetes, this Ayushman wellness schemes have a great role in it. And we should deal with it. There are programs also going on for the mental health and national program for elderlies. We can integrate it with the geriatrics problems, and we can integrate the program, and we can use its infrastructure. Obviously, in such a country where we have a budget problem, we always have a budget problem, then these things, when we integrate, it leads to cost cutting, and we can do it in cost effective manner. Communities participation is must, and we should also bring in the norms, societal norms into the consideration. All these things we should sit together and develop a program which can be reproduced at the grassroots level. Thank you, sir.
Thank you, Dr. Prasant, for summarizing so well. I think you have done my job. So I'd request, because of lack of time, before I summarize in one line, if anybody of you have any question, if you don't ask, I will ask then. Yes, madam, please. Koi mic dega?
So first of all, thank you so much for bringing out beautiful and insightful discussion. So my question is, given the rising elderly population in India, what one policy or system level intervention do you believe could make the biggest difference in early detection and long-term dementia care?
I think Dr. Prasant has just answered your question.
Yeah, but I just want to know one policy system level
Dr. Prasant, you want to say anything?
Madam, like if you start with at the household level, the person comes to you, you are the family member, and he suddenly began to self-neglect. Sometimes patient goes in depression, and he is not replying to your answer, he is unhappy. Sometimes person are agitated. These things should be identified. That sometimes we say that these are the geriatric, जो बूढ़ा है, बुढ़ापा आ गया है, इस तरह का हम बोलने लगते हैं. पर better should be कि such people are brought to the geriatric clinics or whoever is the first responder. And
so what Dr. Prasant wants to mention is that it has to be from individual level. So awareness is the first thing probably, and government will of course spearhead this. Doctor will prescribe it, create the standardization, and community has to participate. All of us has to ask this question, right?
I would like to add one thing, that we should focus on training of the primary care physicians.
Yeah.
So they are the first contact of our community, and they should understand these screening tools and importance of these preventive measures. Then this can be translated to the Anganwadi workers and ASA workers. Like जैसे child health का programs हमने किए हैं, ऐसे ही senior citizens के लिए भी we have to create some like Asha Mitra or like caregivers. We have to create in the community also, so that they will also get the jobs. And like in the budget also it was focused that we have to create a caregiver force in the community itself, so that they can, because it's very difficult to diagnose dementia or these things in OPD settings. Those who are living with them, the primary caregivers are the best judge to report these symptoms.
So we will take question outside because of lack of time.
But I would like to thank you, Dr. Vijay. I was expecting this policy intervention, which you just mentioned on primary health care and giving trainings to the primary health care. Thank you so much.
Thank you. Yeah. Thank you. So we will conclude. So we have just 1 minute. I'll wrap up. Madam mentioned about social prescription, community level participation. Dr. Sumit mentioned about right doctor for hearing aid and health protection. And then Dr. Vijay mentioned that hospital level Detailed assessment is not possible, but of course as a geriatrician we do it. We have to quickly assess because a geriatrician needs to do a wholesome comprehensive assessment ranging from vision, hearing to mood, memory. And Dr. Prasad rightly mentioned that it has to start from your lifestyle. Physical activity we couldn't touch upon because that is one of the, again, major risk factor for dementia. Then smoking cessation, alcohol cessation, these things we know but we don't practice. Managing diabetes, hypertension adequately in right time. Obesity is again a big issue which starts even at the age of 18. Then social isolation, again one of the major factor for depression, dementia, anxiety. These are all interconnected. So it has to be government led. Training is definitely is needed. Awareness has to come in all level. And remember, all of us are at that risk and the bomb is ticking. So we have to, and one last thing is, it's like memory or muscle, use it or lose it. If you use it with a purpose, it will be fine. New skill play a major role. You have to always fight with your healthy fight, that we call as hormesis. Thank you.
Thank you. Thank you very much indeed for that wonderful session. I would request Mr. Anil Rajput sir to kindly do the honors of presenting a memento as a token of gratitude and appreciation to all our eminent panelists. We begin with our moderator, Professor Dr. Prasun Chatterjee. Thank you, sir, for wonderfully moderating that session. And to our speakers, Dr. Prashant Singh Walia. May I request you, sir, to kindly come forward. To Ms. Malti Jaiswal. To Dr. Sumit Mrig. And to Dr. Vijay Kumar. To Dr. Vijay Kumar, and I would request all our eminent panelists to kindly come together in the front for a group photograph with Mr. Anil Rajput. Ladies and gentlemen, requesting everybody else to kindly remain seated as we will straight away move to the proceedings of our next session, which is on the importance of assistive technology in geriatric care management. Just give us a moment while we do up the top table for the next session. So ladies and gentlemen, as we move to our next session, vision and vision support, care coordination, and a reminder tools, and the emerging potential of AI, robotics, and personalized geriatric care solutions. And it is my pleasure to invite on stage our distinguished moderator for this session, Dr. Prashant Kulshreshtha, Chief of Medical Sciences, Indian Spinal Injury Center. He brings extensive clinical and administrative experience in rehabilitation medicines and integrated care, making him ideally placed to guide this discussion on assistive technology in geriatric care management. And ladies and gentlemen, inviting our eminent panelists, I invite Professor Dr. Ajay Gupta, HOD, Department of Physical Medicine and Rehabilitation, VMMC and Safdarjung Hospital, Dr. Ravinder Singh, Scientist D, Division of Non-Communicable Diseases, Indian Council of Medical Research, Ministry of Health and Family Welfare, Government of India, Dr. Saurabh Chaudhary, CEO, Medical Director, Eye Care, Eye Hospital, Noida, and Mr. Raj Sharma, Founder and Director, Priority Hearing. So ladies and gentlemen, with that, I hand over the proceedings of the session on the importance of assistive technology in geriatric care management to our distinguished moderator, Dr. Prashant Kulshreshtha. And I would request you, sir, you have about 30 minutes to carry forward the proceedings of the session. And if the time gets over, we will not be able to have question and answers. Over to you, sir.
Right. So thank you so much for allowing us 50 minutes, if I'm 50? 30. Okay. So 30 minutes, and that too for something like assistive technologies and geriatric care. We have been listening since morning on what is happening in geriatric care. A lot of discussions have happened around medical side. And I'm pleased that we kept this topic, which is very relevant and very important. And I have some wonderful panelists along with me in assistive technology. So from Dr. Ajay, we'll listen on what is happening in assistive technology from medical perspective. Then we have somebody to guide us on the ICMR and national level policy initiatives from Ravinderji. And then two of the very critical things related to aging, which is about loss of vision and loss of hearing, which often leads to the social isolation that we have been hearing of and a lot of cognitive issues. So we have Raj on hearing and Dr. Saurabh from the eyesight to give us an insight onto it. So quickly moving on into getting the assistive technology market and what it is about and how we are progressing in this. I'll go to straight away to Dr. Ajay. So Dr. Ajay, we have seen that the fall, which is one of the major issues in geriatric age population. So beyond the normal sticks which are used, is there any role of assistive technology there, like kind of sensors or anything which can be used in the technology or the products which are there to have a fall prevention?
Good afternoon, Dr. Prashant. Thank you for starting up that discussion, and thank you, Rohit Saab, for inviting us here and organizing this great meeting. It's a very pertinent question that you have put forward. Falls in the elderly, we are looking at about 25% population which is elderly in India, and this number is obviously going to grow over time. And falls, the incidence of falls is close to about 60% in the lifespan of the elderly, that the person is going to have a fall at some point of the or the other, a fall which can be consequential. How many falls are consequential? Which means how many of these falls will actually result in a fracture or in a serious injury? Close to about 12 to 20% of these falls are estimated to actually result in an injury. And what is the impact of that injury? If you look at financial terms, the published average costing of medical management for these injuries runs to about 50,000 to 1 lakh rupees as an out-of-pocket expense. Now that's a very average figure that includes a very broad-based population, and in the serious cases this can go up to a few lakh rupees. What are the consequences? The consequences could also be fatal in some cases, like hip fractures, in which mortality rates are as high as 60-70% taken over 1 year after the incidence of fracture hip. And in other cases, it can result in a significant functional loss or limitations in the ability. So obviously, given this background, it's very pertinent and important that we prevent these falls, because prevention is the actual management here. So what are we doing for this prevention? To understand prevention, we need to understand two primary reasons why these falls would occur. One is propensity to fall. So the elderly have a greater propensity to fall because of their health conditions. They have loss of muscle mass, they have sarcopenia, they have balance issues which are happening over the time as they age. And second is the environmental factors, which means they will have barriers around in their house, they will have limitations of accessibility, they will have urgencies in the night, and they will be unable to get to the bathrooms, which is the most common area where falls occur. We have simple devices, of course, you can use canes, you can use walkers for these fall preventions, adequate lighting. But moving on to what is the role of AI and the newer technologies in this, the newer technologies can help the elderly in guiding on the environmental factors. For example, now there is a lot of radar-based devices which are wearable devices, or which can be attached to the cane or a walker, which can sense the surrounding. If there are any obstacles around in the surrounding, they can tinkle an alarm which will be alerting you, and you can slow down your speed, pace, or adjust to that. Not only that, you could have smart walkers which can apply brakes if there is a rapid movement in the walker, more than the expected pace. So that will not allow the walker to slip, and it will become more stable and the person can stabilize. Other than that, you can have technologies which can sense a fall. These technologies are already available. I think recently Apple came up with one in its Apple Watch, which has fall sensor, and it waits for about 1 minute or so. If you do not respond, then it will also call in the emergency services or whatever number you have put in. So there is a lot of scope for the modern AI and the modern technology to get into fall prevention and have these devices incorporated. You can have motion sensors, so you can have a bedside sensor. As soon as the person tries to get up, the room is already lit, the washroom is already lit up, and you can have
Great, Dr. Ajay. So I think what you have conveyed very rightly to the audience is that there is a role of sensors and sensor-driven technologies in prevention of the falls. And quickly going on to understand what NLEAP or the National List of Essential Assistive Product listing is happening at the national level, I'll go to Ravinderji to understand that, Ravinderji, what we are doing for policy integration for promoting these assistive technologies to get beyond the primary care. I mean, we see that these things are more focused right now in tertiary care. So what is being done to get these things adopted at primary healthcare level?
Thank you, sir, and good afternoon to everybody here, and thanks to Illness to Wellness Foundation for organizing such a wonderful program. First of all, when we talk of integration of any technology into program, it becomes institutional centric. We have to create the people centric programs. Little bit background of NLEAP document and NLEAP initiative by Indian Council of Medical Research. It was on the pattern of assistive product list by WHO, and we have 21 list product listed in this list, and now our next target is to integrate into the primary healthcare setting level. The problem is if we go by the definition of assistive technology includes services and personnel, systems, and assistive devices or products are used interchangeably. So for first to embed them into routine geriatric care pathways at health and wellness center or primary health center, it should not be treated as add-ons. It should be part of mobility aids, like simply mobility aids, vision, hearing aids, or incontinence products, which we don't consider as a health product. But our NLEAP has very categorically stated that incontinence products should be treated in this list as a part of health products. And fall prevention, like Professor Ajay Gupta has said, they should become part of standard geriatric assessment packages.
Right. So I think it is more of the adoption at the care provider level that they should consider these things not as value add but basic essentials.
Exactly.
So that we can not only advise them but make them aware that these things are available and that it will be better off with the patient to be
Second
using
is task shifting, and third is listing NLEAP with Ayushman Bharat or health benefit packages, HBPs.
Correct.
So which is important.
Right. So as you have already covered some highlight on the visual aids and hearing aids, so instead of getting into that, I think I'll go to Saurabh to understand. Saurabh, is that we are doing something good enough to reach out for eye care to home? you know, because geriatric people, they have issues around mobility. We all have already discussed it. So what is that the ophthalmic society or ophthalmic professionals are shifting to, so that eye care can be taken to their home, teleophthalmology, or maybe, you know, screening which can be done on technology based? Are there anything like that which is shaping up?
Right. So, unfortunately, the number of people in India, there's so many people that all the policies cannot cater to them. So, when you're talking about Delhi, there are not too many initiatives from the government to push people into ambulatory care, or for people to be going into, caregivers to be going into the houses to look after, especially the vision. Where I come from is an NGO, and we have a program where we've got 2 vans with the paramedical team. These teams go out to the homes, screen the patients, look at various diseases. Now, as I said, these are paramedicals. So once they are paramedicals, we have got some fundus cameras, which are AI based. In the sense, initially, when we used to study, we had some photographs on which we used to grade the type of diabetic retinopathy or the age-related macular degeneration, but now it's all been in these programs, which are all AI generated now. So we go there, we screen them, and this is remotely coming down to the specialist at the hospital, where they give their opinion. We also have portable lasers and portable machines which can go down to the houses, but this is only for the people who can afford it. Now, our NGO is also going into the rural parts where there are old people, and these old people are more affected because their relatives and everybody are on their daily schedules and the daily workers, so they just can't take off their time and get them to government hospitals where there'll be long queues, where they'll have to wait for long days. So as a result, these are the most neglected lot. So as a part of our NGO, the Eye Care Eye Hospital, we are doing about 20,000 free surgeries every year, right, which are totally free of cost for the patients, and about 12,000 which are retina related. So it's a big number, and I think the way forward is to push the government and let them realize that if there is no sight, the independence of the patient goes down. If the independence goes down, the isolation comes in. Less of when there is isolation, there's physical and cognitive decline, which,
correct.
And that's what we've been talking about.
Correct. So morning also we heard that, you know, loss of vision is somehow also linked to the cognitive losses, which obviously are resultant on that. And good to hear that you are going out and screening, but I think a lot of advancements need to shape up where, as he is correctly saying, that AI or the predominant available data is available for a quick screening by paramedics and somebody who is not trained ophthalmologist, but at least they are able to screen the condition for the aging person there at the home. So quickly now moving on to Raj. And Raj, we have heard a lot about all these things since morning. We have been hearing to this, but I would like to bring a question around the stigma barrier. You know, so hearing aid, often if I say happen to recommend somebody that you know you need a hearing aid, so they are like taken aback and they feel like, why? I mean, this is such a stigma for me to be wearing a hearing aid. So what is that the audiology society or ENT doctors or practitioners in hearing side, they are doing to break this barrier and take this particular thing to be perceived as a wellness factor?
Sure. Thank you, Dr. Prasant. Anil, well put through the question, I appreciate. In the beginning, I should say it's not just a stigma problem, which we usually hear and say. It's if we just redesign and rethink to the root cause, you will be finding a different narrative altogether. And let me set that narrative and share that narrative to you so that you agree. Narrative happens to be, कोई भी हमारे पास आता है, ये एज ए प्रोफेशनल भी मैं आपको बता रहा हूँ और एज ए फैमिली मेम्बर भी मैं आपको बता रहा हूँ. कोई भी हमारे पास अगर आता है तो हमें ये लगता है कि इनकी उम्र बढ़ रही है so hearing aid लगा देनी चाहिए. Now there we put a label of old age, not acceptable. Another narrative we set, even as an audiologist, as a professional also, कान कमजोर पड़ रहा है या कान की सुनाई की कमी हो रही है. Now we another put a tab on the same elderly gentleman of weakness. Slowly and gradually, we start putting a different label of disability on the aging populations. Now that is not acceptable. We ourselves will not accept with open heart. The things goes differently if I share the data that 63 million Indian populations having the hearing loss problem out of the 430 global population. And to add it further, because we are discussing the aging, all the aging problems, 1 out of 2 above age of 60 years, they do have sizable amount of the hearing loss. I'm talking with respect to the Indian context. And it's a big number. Now, out of that also, the population which reaches to us, to the clinics, to the hospital, is as meager as 6 to 8%. Further to add to it more, within that, the population who reaches 6 to 8% to us, they reaches 7 to 10 years down the line. Now this whole of the sequence, if you try to analyze, you will find that the things has to be beyond this taboo or stigma we are talking about. Now I simply want to shift this weakness to the strength, and I will be adding one paragraph here, that I need to provide my patient a better mental health via good conductions, good auditory conductions and the strengthful auditory cortex, so that there is no going to be the further structural degenerations, and a good brain health is going to be what we want to impart to our, what want to strengthen our patients or elderly. Another about the social health, we don't want any kind of the irritations, isolations. Isolations can be isolations full of the people here also. It's not just singular isolation in number. Right. Isolation can be within the family also. You know each and everything family member is well connected, but you isolated, and so on, so forth. So I simply want to say that let's shift the paradigm from the weakness to a strength. We will find a better reason and better answer to this problem overall.
Right, so in your practices, just a quick 30-second answer if you can give. In your practices in priority hearing, are you also trying to integrate the AI-based systems which can interact with your mobile phones and give you a better hearing capabilities and also remain affordable?
Absolutely, because we have to be updated with the technology, or we have to be hand in hand with the technology, with the growth going on in the digital and the AI age. All these hearing devices are AI friendly, AI integrated, including the fall. The hearing loss increases the fall risk 3 times.
So if you can quickly give me one name if you are using any such device.
There are many. I'll not go for the brand name and others on this podium, but there are a lot of the advancements. Most of our instruments are AI integrated. Right. Most of them are having the fall alert systems, what my counterpart or we were talking about. Most of them, they do analyze what kind of the environment you are sitting and how exactly they need to behave through the programming, auto programming, or the manual programming, or audiological programming. So advancements are there. But all said and done, what I'm differing here, sir, is technology is one aspect. My patients is another aspect. The technology, the patients need to adapt with the technology, and it's not vice versa. My mother still uses a number 1, 2, 3, 4 mobile phone. I tried hard to push through 2 times, 3 times to go into the smartphone another, but silently she shifts it back to that. So I need to respect that element simultaneously. What is more adaptable is more accessible and better in version to go ahead with.
Thank you, Raj. With a scarcity of time, I'm cutting you down, but you can always spread your message to them. Quickly, 30-second answer from Dr. Ajay. At Safdarjung and running this PMR department there, Can you quickly just give us an insight on use of some kind of robotics or assistive technology driven by AI at Safdarjung, which has been currently under trial or under established practice? And how do you think that these things can actually become affordable for people at large?
I'll try and quickly summarize on what you are saying. So at Safdarjung, for example, we do robotic-based balance training for the elderly population. That's one part that we have adopted. And of course, Safdarjung is an institution-based model, not the best model for all the elderly care. Okay, it's only a limited number of people who are coming there and getting that advantage. But I will try to highlight that technology ain't expensive. I have been there in many DST research review councils, and where I've seen a lot of projects coming up with those technologies. Technology per se is not expensive. It's the commercialization which makes it expensive. And there are two factors in commercialization. One is the profit that the commercial entity is wanting to have, and second is the adoption of the technology. The greater the adoption, we are expecting lower costs coming in.
So point very well taken, and I think as we could hear from all the panelists is that there is certain degree of adoption on technology happening in various settings of what they have been driving. We see government institutions doing something about it. We see the private players trying to use technology and go beyond what is the normal thing. And I would like to create some insight into the audience here, and I'll just quickly give you some numbers on assistive technologies in geriatric care. So as Mr. Rajput has pointed in the beginning, that there is something called silver economy, right? So silver economy of the geriatric care market in India today sits at about $7 billion US, which is going to expand, as we have already heard that population is on rise for geriatric and all that thing. The second component, out of the 7 billion, you will be surprised that barely 900 million is what is the market size for assistive technologies, all combined together, hearing aid to visual aids to sensors to mobilities to wheelchairs to advancement on environmental sensors or whatever. This is 900 million. Now, out of all the discussions here and from all the panelists, if I summarize, we heard that there is a lot of awareness issues. People do not know that these things exist. Second is availability. It is not available everywhere. It is very, very institutional centric or location centric. And third, obviously, as Dr. Ajay has pointed out, affordability. So these things are that we need to fight out. But the best thing is that if we see the growing trends of these two markets, so the silver economy of the top line 7 billion is rising at a CAGR of 5%, while this 900 million market is growing at 22% CAGR. So there's lot of things which are going to change in the assistive technology side. So with that, I thank all my panelists. And it had been a wonderful panel, right from policy to hearing aid to everything we could hear from what is happening at their forefronts. And I like to summarize the assistive technologies in geriatric care as one simple thing, that possibly with the kind of population and load that we anticipate in a country like India, I think until and unless adoption to assistive technologies and the technologies do not happen, we will not be able to cater each and every person who requires care. So thank you so much for being a nice audience. If there is any question, we can take up possibly one odd question, if not more, because madam is there. She has given me 30 minutes. And I'm right in time? I'm right in time? Right. I can take one question if there is any. So there's no question, means either we were excellent or maybe that we didn't send the message across.
Sir, let me sure. Say about your economy you talked about.
Right.
1/3 of the Indian population need assistive technology. That is the figure which we have calculated, and On an average, I'm talking of whole of the population, and 12% of Indian population is elderly, which is not, almost all of them, they need 1, 2, 3 technologies at any given point of time. And we have calculated it by saying that if we provide a technology for 16,000 rupees every year to the older person or to anybody else, so it is $1 trillion industry. Industry is not growing because they don't see business here. So now we are trying to tell them that there is a lot of business, so please do come into that.
Right. So even I meant to give this message out to the people here that maybe one of you would take this as a business initiative. And this is going to be wonderful. So thank you, Ravindraji.
There are a lot of, like I mean to say, when I look into the AI market for the visual aids, the low visual aids, I think most of the inventions are coming from India. In the sense that it is not, just because there are a lot of startups, the Made in India and the Make in India initiative by the government. So quite a few of the startups which are, so we do realize that some of the products which we are using are now from India rather than coming down from the West.
Right, sir, right. And very well taken. And we do have brains, no doubt about it. We have the market, no doubt about it. We have a government which is driving Make in India, so no doubt about it. We are getting back to our roots, no doubt about it. Anilji is taking initiatives like Bharat Ki Soch to take us all to the mantranas. That is there, and that what needs to be taken forward and done something wonderfully well. Thank you so much for being a patient audience. Thank you so much.
Thank you very much indeed, sir, for that wonderful session. I would once again request Mr. Anil Rajputji to kindly do the honors of felicitating all our eminent panelists. We begin with our distinguished moderator, Dr. Prashant Kulshrestha. Thank you very much indeed, sir, for wonderfully moderating this session, concluding it in time. We present to all our eminent panelists, Professor Dr. Ajay Gupta, to Dr. Ravinder Singh, to Dr. Saurabh Chaudhary, and to Mr. Raj Sharma. And I would request all our eminent panelists to kindly come together in the front for a group photograph along with Mr. Rajput. And ladies and gentlemen, requesting all our delegates, participants, and all our guests to kindly remain seated as we straightaway move into the proceedings of our final session of the day. That is a session on healthy and graceful aging through nutrition, spirituality, meditation, and yoga. We would request you to just give us a few minutes while we arrange the top table for the next session. So ladies and gentlemen, in sustaining energy and immunity, essential nutrients for bone, brain, heart, and digestive health, and how meditation and yoga can enhance the emotional resilience, flexibility, mobility, posture, and also fall prevention. It will also highlight the importance of breathing practice or pranayam in supporting respiratory and cardiovascular health. It is now my privilege to invite on stage our distinguished moderator, Dr. Rajesh Kesari, Honorable Member, Advisory Council, Illness to Wellness Foundation, and Member, National Executive Committee, Elect Research Society for the Study of Diabetes in India. Dr. Kesari brings a strong blend of clinical insight and preventive health perspective, making him well placed to guide this holistic discussion. I invite our eminent panelist, Professor Dr. Kashinath Sarnagandi. He is the Director, Morarji Desai, National Institute of Yoga, Ministry of Ayush, Government of India. Warm welcome to you, sir. Inviting Dr. Ishwar V. Basavaraddi, Director and Professor, Center for Yoga Wellness and Integrative Medicine, Mahatma Gandhi University of Medical Sciences and Technology, Jaipur, and also the former Director, Morarji Desai National Institute of Yoga, Ministry of Ayush, Government of India. We invite Dr. Deepak Shukla, spiritual health expert and former CEO, PSRI Hospital, and Ms. Sonia Mehta, founder and clinical nutritionist, Everbloom. So with those words of introduction, I hand over to our distinguished moderator for the session, Dr. Rajesh Kesri, to kindly carry forward the proceedings of the session. Sir, you have about 35 to 40 minutes for the session. Over to you, sir.
Hello. Yes, first of all, thank you so much. I must once again congratulate and thank the whole team, Illness to Wellness Foundation, and the head of it, Shri Anil Rajput ji. He's been carrying out this excellent initiative. I think this is 4th or the 5th program that I am personally attending on geriatrics and graceful aging. The fact that he has taken up this initiative and we are highlighting this issue and bringing specialists from different specialties and carrying the message across of geriatric care, not only to the society but to government institutions itself is very important. Now let's see how important is it for all of you sitting here. How many of you would like to live 100 years? Please raise your hands. Hardly 5, 10? That's very surprising. You know, there's a blessing in Sanskrit, Jivem Sharde Shatam. So this is what my father, whenever he goes to any birthday celebration, he would say Jivem Sharde Shatam. And I think Dr. Agrawal also mentioned about, and Ms. Malti is there, that they brought out a paper titled this. So the age of 100 years has been recognized in our Vedas, in our ancient wisdom, and we should strive, and I think we can achieve that, provided we do all the efforts. Now there's certain, we've been having a lot of discussions since the morning, and a lot of them have touched upon the medical issues which the geriatric population or which the aging population faces more frequently. So for example, it is falls, prevention of falls, because falls have consequences we just heard in the previous session. Frailty, cognitive dysfunction, and loss of cognitive reserve, social isolation, emotional isolation, interdependence. So these are all issues that we need to address. And I'm so fortunate today to be amongst a very, very important, I would say, galaxy of panelists. You know, usually I am moderating medical issues like obesity and diabetes. Today I'm very happy that I am amongst Dr. Deepak Shukla. He is a very renowned medical specialist on spirituality. You see, spirituality is the food for our soul and our mind. So it is very important that we consider this, and we're going to discuss this today. And also with me, I have Dr. Basavara Reddy and Sir Dr. Kashinath, and who are going to talk about yoga. Now, why yoga is important? It is really very important because yoga provides the movement and flexibility. As we've just heard since the morning in many discussions, movement is very important to preserve our muscle strength, and our muscle is an indicator of our cardiovascular health. So these things are important not just from the perspective of social integration, movement, and they're also important from the perspective of cardiovascular health. So we're going to touch upon that. Then we have Ms. Sonia, and she's going to give us the food not only for thought, but food for the body, the nutrition for the body which is going to keep us healthy. So starting with the ancient Indian wisdom, there were three things which are very important: ahar, vyavhar, and vyavhar. To that, I would add adhyatma. So, sir, honorable sir, we would like to start with you. What is adhyatma? What is spirituality? Is it only religion? How does it intersect with our day-to-day lives? Because I think we actually don't have the understanding of spirituality. Somehow we confuse it with different things.
Thank you so much for inviting me on this very important topic. You see that spirituality is beyond the domain of the religious people. One very fundamental thing is this: religion and spirituality are two different things. Religion is a way of worship. Anyone can profess any religion. And spirituality is across the board. It is beyond the caste, creed, sex, religion, and the cultures across the world. It is a way of life. Since I am a doctor and I am dealing in the spirituality as a doctor, so in the WHO definition of health, it is a complete physical, mental, social well-being of an individual, irrespective of the infirmity or the disease. So one more dimension was added in 1989-90. The fourth dimension was the spiritual dimension in WHO definition. Incidentally, because of the confusion of the religion and spirituality, it is very surprising that it was dropped from that, again, definition of health in 92. And I had a presentation in World Hospital Congress in 2007, where WHO General Secretary was also there. And I asked her why spiritual component was dropped from the definition of the health. So our straightforward answer was, Dr. Shukla, we do not have a plausible anatomical and physiological correlates of spirituality. And it is since that date that I have been working to evolve and to define anatomical and physiological correlates of the spirituality. And since last 15-18 years, I have been able to do that in a most satisfying way with certain applications. Your one part of the question was application in the day-to-day life, how it is related. One thing is this: spirituality is not a subject of individual sitting in isolation. Let me tell you frankly, if you want to increase personal productivity, if you want to improve institutional productivity, if you want to have excellence in the performance through any vocation or any profession, spirituality helps there. It complements all other efforts, whether they are HR related efforts, whether they are other management school approaches. And this I have been doing for the armed forces, I have been doing for the business schools, I have been doing for the industry. And my experience is very satisfying and it is very rewarding. Let me tell one last thing about this. It is a way of life. And in 2011, in Munirka, there is a National Institute of Health and Family Welfare. And for the first time, we developed one spiritual health scale. It is first time in India. You can search on the net, and if you search the website of the National Institute of Health and Family Welfare, NHFW, you'll find a spiritual health scale evolved. And this scale is a scientific tool to assess the spiritual quotient and spiritual status of an individual. There is a small booklet of 100 questions, and with routine ticking the questions, you can judge yourself that where you stand on the spiritual health scale. I think that I'll stop here because you see it is such a it is such a lovely topic close to my heart that I can go for a very long time, but looking to the time limit.
Thank you, sir. We
Thanks.
can feel the passion in your voice, and during yesterday's discussion, I could really feel that you're completely devoted to it. So I think we are very, very lucky to have you here. So I'd be putting up more questions to you, but moving over to you, sir. So how can yoga help us with the issues that we face in the elderly geriatric populations? And specifically, I would request you to talk about muscle strength.
Hope I'm audible. Not open. Thank you, Dr. Rajesh ji. So before I answer which kind of yogasana will help to improve the muscle strength, just I would like to when this interaction was started, sir started with the beautiful question that how many of you want to remain 100 years? But very barely I was able to see the hands who are literally willing to remain 100 years. Because why I want to state this line, because as we all know that human beings, being a human being, again we all know that it's a fortunate to be a human being. And हमें सभी पता है कि 84 लाख योनि के बाद we will get the opportunity to be a human being. And main aim of all the human being is to achieve the purusharthas, dharma, artha, kama, moksha. And to achieve these 4 purusharthas, ultimately you need to have a healthy long life. There was a beautiful movie, Anand. बाबू मोशाई, आपका ज़िंदगी लंबी नहीं बड़ी होना चाहिए, लेकिन इंडियन नॉलेज सिस्टम ऑलवेज एम्फसाइज दैट आपका ज़िंदगी बड़ी भी होना है, लंबी भी होना है. यू नीड टू हैव ए हेल्दी लॉन्ग लाइफ. व्हेन यू हैव, देन ओनली यू कैन अचीव द धर्म, अर्थ, काम एंड मोक्ष. दैट इज अल्टीमेटली व्हेन यू enter into the spiritual path, then you will attain the ultimate liberty. And even Shastra also emphasize that if you want to remain a healthy life, you need to stick on to the Indian knowledge system. That Shastra says that swasthavrittam itedishtam samyak anutishtati shatam vyadir ayushanam. If you want to remain 100 years, you need to stick on to the healthy long life. That is what explained in the Indian knowledge system. And moreover that, we are the human beings. We are different from the animals. Very important part which differs us from the human animals is that we have a intelligence. Ahara nidram bhayam maitunam samanya metat naranam pashubhivi. All these 4 components are common with animals and the human beings. Ahara, nidra, bhaya and maituna. Only which differs human beings from the animal is the buddhir metat, buddhi. So when you have beautiful mind, when we have a beautiful intelligence, we need to use that intelligence to achieve all the purusharthas that is possible when we attain the healthy long life. So ultimately, to remain healthy long life, we need to stick on to the Indian knowledge system, preferably Yoga and Ayurveda. And fortunately, I belongs to both the fraternity. Coming to the last, because I didn't answer the question, how to improve the muscle strength. Let me tell you, because as we, only 30 seconds I will take. So as age progress, our BMR, basal metabolic rate, go on decreasing, and research says that 1 to 2% of BMR is reduced after 1 decade. So ultimately, when BMR is reduced, ultimately all the nutrition what we need for our nourishment of all the muscles, that will decrease us. So just adopting the just simple Surya Namaskar. I know that in old age people, they may not do this one. So with the help of using the props, sitting on the chair, if they perform certain asanas, that will gradually improve the circulation to the muscle. So when the circulation is improved, ultimately even it will take up the nourishment what we need. So when nourishment and circulations are provided to the muscle, ultimately, gradually we can improve the muscle strength.
Thank you so much, thank you. So we would go over to Sonia ji. Sonia ji, you have lots of thoughts about nutrition in elderly. It is really great, and it is wonderful that you understand the needs of the elderly, and especially the needs of. Now, why are we talking a lot about muscles? Because sarcopenia is a very important issue that we face with the increasing age. What is sarcopenia? Sarcopenia is the loss of muscle mass. We, with age, do lose our muscle mass. So this muscle mass has to be built in childhood. The building of this muscle mass should start very early. But it is dependent on our physical activities, and it is dependent upon the nutrition that we have, because that muscle has to be built. It has to be built from signals which our activity gives us, and it has to be built from the basic proteins which come through our diet. So here Sonia ji is a very, very relevant question to you about the role of nutrition in healthy aging, and that would obviously be related to protein intake. How to increase that and how to go about it?
Good afternoon, everyone, and thank you, sir, for the question. So when it comes to protein intake, first of all, as Indians, we do lack in protein in general in our Indian diets. A lot of us are vegetarians as well. So with Indian diet and vegetarian diet, protein is inadequate in our diet. There is a lot of misinformation that is being spread about protein, and because of that, there is fear of protein intake. But I would like to spread the message, do not fear protein intake, because most likely you are inadequate in protein intake. For Indian seniors specifically, you need to target 1 to 1.2 grams of your kilogram body weight, and that is the amount of protein you require. So definitely protein is a very important thing. If you are vegetarian, you want to make sure that you have a balanced diet, because the high chances that the protein you're intaking is an incomplete protein, because it doesn't have all the amino acids that are required for your body. So you need to make the right food combinations to make sure that you're getting adequate protein intake, but also high quality protein intake. And you should work with a clinical nutritionist for that as well, if this is something that you are doubtful about, how to make sure you're getting adequate protein. Despite that, if the food first approach does not work, there are a lot of supplements available also in the market, but that is also something you need to carefully pick out with the help of a clinician. So protein is extremely important. Just to summarize, it helps prevent frailty, it prevents fall, it helps with your immunity, it helps to maintain your muscle mass, which is a very big factor in longevity.
Thank you. You know, we have, I think, almost 200 to 300 people sitting here, and whatever we are saying would also be available on the net, and the impact actually is going to be huge. So I would certainly request some practical give out. So for example, an elderly person, 70 kgs of weight, what should be the diet? Can you give some specifics so that people sitting out here, they take that message home and they start practicing it?
Yes. So you want to focus, especially for seniors, you want to focus on smart nutrition, not just restricted nutrition, because a lot of times with a lot of health issues, people start restricting their diet. You want to make sure there's enough nutrients in your diet. The best way to go about it is to put together a balanced plate. To put together a balanced plate, you need half of your plate to be full of vegetables and fruits, basically fiber. 1/4 should be protein, and the other 1/4 should be starchy carbohydrates, particularly whole grains. And you also want to make sure you want to focus on your gut health, because that is a very big indicator of your immunity and your longevity as well. And that comes from probiotics such as curd, buttermilk, kanji. So make sure you're eating a balanced meal. If you want to break your meals into breakfast, lunch and dinner, that is also a good idea. But let's say with aging, a lot of times appetite also decreases. It's not necessary we stick to the norm of breakfast, lunch and dinner. You can eat small meals, but eat frequently, and make sure you are targeting all of these macronutrients that I'm talking about, and eventually micronutrients will also follow.
I'll come back to you with again this question once again. In the meantime, sir, how to practice spirituality? If I'm sitting there, I go home, what should I tell my father that please do this?
You see that spirituality in the ancient and the Greek cultures has been considered at par with the hygiene and purity. In very simple words, The thing is this, that you have to follow spirituality, you have to be natural. Go close to the nature. 2-3 things. There was some food about the yoga. Let me tell you that spirituality is a path. Yoga is a process, and self-realization is the goal. Yoga is a bus on which you travel on the road of spirituality to reach self-realization. Am I right, sir? So how to travel this bus and on the road of spirituality? Things are very simple, not very complicated. You should try to become more with yourself. We have a tendency of digression. We try to learn so many things about the external world, but we hardly find a time or feel need to know about yourself. So I mean to say, the soul searching or to look into yourself is the basic approach to follow spirituality. And what are the activities which take you to this journey in this way? There are many things. One thing is this, that you can read inspirational books, you can have a nature walk, you can engage yourself in the social activities, you can follow certain devotional or artistic things, engage yourself in art, painting, poetry, writing some essays, etc., etc. And at the same time, practicing yoga. Yoga is a Ashtanga yoga. It is from Yam, Niyam, Asana, Pranayam, Pratyahar, Dharana, Dhyan, Samadhi. It is a very scientific approach, and erroneously doing some postures or Surya Namaskar or Asana, we say we do yoga, but yoga has a very broad spectrum, and everything has got a importance in your development. So coming back to your issue, in the aging population, because we are trying to address the aging population issue, otherwise we can speak so many things about it. What happens in the old age? In the old age there is isolation, there is a depression, there are different types of distress, there is a need of medication, there are many chronic illnesses, there is a need of chronic caregivers. So what I mean to say is this, if we address how to follow spirituality in the aging, then I think that in the simple words, light physical exercises. Sir was telling about the Surya Namaskar. I think Surya Namaskar is the most supreme type of the yoga vyayam, which provides all types of benefits to the body. But he also rightly told, our body elasticity, our body functioning, our joint conditions in the old age may not permit anyone to do the Surya Namaskar. So that there are 10 postures in the Surya Namaskar. So what one can do? This is one thing. Second thing is this, in the old age, spirituality, if you want to go back into yourself, breathing exercises, pranayama. And this breathing should not be very loud. It is not done, this is a mistake. It should be done so lightly that no one can listen even your breath sitting next to you. Breathing is a metabolic activity. It gives direction to your body. And then in the old age, there has to be some provision to encourage them to talk to the people. Because you see that it takes care of their emotional care, emotional support, their expression. In the old age, people want to have some vent, what to say and to whom to say. And then all these things which I earlier told, that how to practice the spirituality, So yoga is one tool, but then the routine life activities, which I have just told, there is a number of the series of the things. Let me tell you that in the Western world, spiritual health approach is called as the mind-body medicine. And they have a very focused department how to give different therapies through the mind-body medicine. So there is there are certain imagery and different process, biofeedbacks, and there are so many tools that how to give, but it is a therapeutic approach. But your intention was how a common man can pursue. So these are the activities, light physical exercise, which also includes a nutritious diet, light diet, doing yoga, interacting with the society, reading good books, engaging in the social activities, engaging in some religious practices. So these are the bundle of the things which can help one to follow the spiritual path in the old age.
So if you would allow, I would just like to carry on this forward a little bit, that as per our scientific and medical understanding of spirituality, as just Sir was telling, we can consider 2 or 3 aspects. What is spirituality? It is first of all awareness. Awareness of yourself being in this world. So it is just not about chanting or about meditation. It is just being in a park and looking at the trees. Now, this is also a spiritual aspect of life. Connection. This is what Sir was just telling about, that, being connected in the society, in the family, in the friends. This is one of the aspects that we discussed since the morning. Many people have talked about the isolation that the elderly geriatric population faces. Now, connections, even just sitting, laughing, chatting, is also spirituality actually. So spirituality is not about just religion, going to a temple, chanting, meditation. Even these practices are spirituality. Integration into life. As Sir was talking about mind, body and soul, where do you see yourself in this life? What is your purpose of life? What do you want to achieve? Now once you'll start looking at your life with such questions, with such inquiries, you already are spiritual. But definitely, meditative practices, chanting, now there are different types of chanting, even Havan is also chanting. This has scientific basis. This has scientific basis. There have been many studies. Sir was yesterday actually telling me about them, that the chanting helps, it has effects on amygdala, it has effects on different centers of the brain. We are all aware about it. So while we are talking about spirituality from the point of medicine, so we know that it actually has positive effects, and it definitely is going to help us in our...
I'd like to add one thing. As a medical personnel, doctor should not be any misunderstanding that spirituality is a teaching tool. Spiritual approach in life complements all the medical efforts, whatever homeopathic, Ayurvedic, natural, yoga, and the health needs. So spirituality complements all those issues. It is not in isolation or a substitute to any other approach which helps in the geriatric care.
Thank you, sir. Very true. Thank you so much. Dr. Ishwar Basavarati. Sir, I'm very thankful. I've had the opportunity to be with you on panel a number of times. And one thing I really appreciated and liked was that you gave very good practical demonstrations. So is it possible, I know you may not be prepared, but to give some practical demonstration of something in our context today?
Shall I speak something?
Yes, please.
Namaskar. We are talking about the geriatric health. First of all, when we talk about yoga, yoga is most related to mind. I have 5 tips and we will have a small practice also. First of all, what manayeva manushanam karanam bandhamoksha. For our health and disease, for our good and bad. Mind is the most important thing. The entire yoga, different kinds of yoga, is addressing the issues of mind, first of all. What is the simple thing in geriatric population? 10 minutes of silence. Sit quietly, because nowadays meditation is misunderstood wrongly, or it is misunderstood. Simply, regularly, without any gap, sit 10 minutes silence. Watch your body, watch your breathing, watch your thoughts. You will start understanding your mind. The second one is the mind works through our brain. Brain and gut are interrelated. For that one, we have 4 instincts, what Dr. Kashinath informed. Ahara, Nidra, Bhaya, Maithuna. If you have any psychosomatic disorders, it is because of mismanagement of these 4. If we did in the youth period or in the middle age, correct them by remedial measures of yoga in 5 ways. There are detoxification practices. There are neuromuscular coordination practices. There are cardiorespiratory efficiency improving practices. Then also there is a quality of sleep, particularly relaxation techniques, and that ultimately leads to you a proper meditation. For that one, we have a Pavan Muktasana series. First, in the geriatric population, supine postures are very, very comfortable. Start with very simple movements of a series. Just note down, and you will get a lot of information on the net also. The second one is in the prone postures, Bhujangasana, and it's not only asanas. Many times we ask for asanas, but it's a group of asanas. We have to make a package, or we call it as a capsule or a protocol, particularly for the individuals. Around Bhujangasana, we develop some 4 or 5 practices. Then in sitting, it is Bhadrasana, then come to Ustrasana and related to some practice. In standing, ultimately it comes to the Tadasana, and there are some 4 or 5 practices. So these 4 leads to proper channelization of our breathing, then we can breathe better. With that one, do minimum 10 times Anuloma Viloma or Nadi Shuddhi, left to right, right to left, and slowly the length of breathing increases. Then you start doing Ujjayi, sitting in the middle, conclude with a Brahmari. So many times we are doing the humming sound, but it is so Brahmari is a completely different thing for the geriatric populations. So now in our Mahatma Gandhi University, earlier I did it in Morarji Desai, we have started certain things for the very particularly geriatric population, such type of small capsules. So therefore that Brahmari definitely enhances the sleep quality. So I don't go into these things. All these things are helping us to manage the HP axis and the synchronization or balance of both sympathetic and parasympathetic network, and also improve the quality of life. That's the important thing we have to follow. It is simple. If it is not possible for in one go, let us break it for 2 or 3 or 4 sessions, 10 minutes each, 10 minutes silence, 10 minutes pranayama, and 10 or 20 minutes of yogasana or something like that. Then sometime 10 or 15 minutes of yoga nidra. So make it in this one, and so that slowly we start living yoga. Yoga is not just practicing for 10 minutes or 15 minutes. What we are talking about spirituality is we want to live what we are. Simple thing. So why it is here, Patanjali says, we come up with a certain karmas, jati, ayu, bhoga. So we are talking about now genetics. So it is jati means we come up with some karmas. So even our ayu is also decided. With these change of modifications in the lifestyle, we can improve our ayu, we can improve our quality of happiness. We are talking about. Yoga is a systematic way, it is Anushasana, it's a scientific process to achieve that. Thank you very much. So with this, we can, if you allow me, we'll practice some
Yes,
simple
yes,
things.
please, definitely, definitely. Thank you.
Yes, we can all sit straight. Yes. Just fold your hands, Namaskar. Take a deep breath. Shanti, Shanti, Shanti. Open your eyes. Lock your fingers. Stretch your arms. Make your body straight. Look straight. Slowly relax your shoulders. Exhale, bring your hands on the head. Arch your upper back, dorsal spine. Inhale up, stretch up. Slowly start breathing in and breathing out, minimum 3 to 5 times. Relax your shoulders, relax your forearms, relax your fingers. Inhale now. Exhale, bring your arms behind the head. Arch it. Inhale. Exhale, press. Inhale, stretch. Exhale, press. Inhale fully. Exhale. Inhale. Exhale. Inhale. Now slowly exhale, keep your palms on the shoulder. Bring your elbows forward. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Now exhale down. Reverse it. Inhale up. Do it very slowly. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Again, bring your hands behind, stretch up, relax your shoulders. Now inhale up. Now we can breathe more. Slowly exhale, bend towards your right side. Inhale up. Exhale your left side. Inhale up. Again, right side. Inhale up. Again, side. Come back. And slowly take your hands on the head. Close your eyes. Take a deep breath. Exhale. See, the length of breathing has been increased. Now slowly keep your hands on the chair. Slowly bend back. Simple. Very good. Come back. Slowly twist your right side. Hold your chair. Come back. Other side. Twist it. Come back. Yes. Again stretch. Now you can breathe much better. Slowly come down. Keep your hands on your eyes. Close your eyes. Take a deep breath. We'll do 5 times alternative nostril breathing. Hold like this. Yes. Inhale through the left nostril. Follow me. Without any friction. Exhale right. Inhale right, please follow me. Exhale left. Fully. This is one round. Inhale left. Keep your spine straight, shoulder relaxed. Exhale right. Inhale right. Full. Exhale left. Inhale left. Exhale right. Inhale right. Exhale left. Inhale left. Full. Increase. Exhale right. Complete. Contract your chest and abdomen. Inhale right. Exhale left. Last round with perfection. Inhale left. Exhale right. Inhale right. Exhale left. Hand down. Just keep the palms one. Slowly deep breathe in. We start doing humming sound together with me. सांस लीजिए, breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Last time, breathe in fully. Just keep quiet. Look at your body, adjust it. Your breath becomes slow and deep, shallow. Brahmari is the great tranquilizer. Just watch your thoughts for a few seconds. Be an observer. A beautiful silence. Take a deep breath. Take a deep breath. Take a deep breath. Feel the relaxation. We conclude with a small chanting of Om. Breathe in. Shanti, Shanti, Shanti. Slowly open your eyes. Thank you. Dhanyavad.
I must confess that I woke up in a different world. Thank you so much, sir. Thank you so much. We are already running short of time, but I would request very quick inputs from Sonia ji. Once again, coming back to specific recommendations, keeping in mind muscle, protein, and fiber, because one of the issues that geriatric population faces is constipation. And on this, if you could also give brief inputs, just brief. So.
Simple one is there are some detoxification practices, especially dhauti. It's very simple and it's a non-pharmacological practice, but should be practiced with the help of an expert one. The second one is what researches showed and also tradition is the Pavan Muktasana. That's why I said series of Pavan Muktasana. We use one leg, two legs, both, and we are also doing Markatasana, and we in between we do Setu Bandhasana, etc. Simple these things, and only thing is we expect the results in the second day. It's a gradual process, in my opinion, always 7 days, it will take 7 to 8 days, it will take to adjust with them. Next, you start feeling it. So definitely after 14 days or plus, you start getting the good results. So many times we immediately, researchers said you do it like that, you will get in 1 day. You feel good, sir, I am eating well, etc. But the 100% better results, you have to wait for at least continuously you do without any gap, at least 14 days. Next 7 days if you do it, 28 days if you do, and that will become a one part. Last one, if you want to adopt these things in part of life, what yoga says or the psychology, it is minimum 12 weeks of Dirghakal and Niryantarya Satkara Sevito. 12 weeks we have to practice it so that it will become a part of our life and we can elevate any kind of constipation or chronic constipation also. We did. Thank you.
Okay, so if we are going into the specifics of exactly what you should be eating, a sample day's plan can look like. So you should start your day with one protein source and one fiber source for sure. So the protein source can be things like eggs, if you eat eggs. 1 to 2 eggs daily is a great requirement as well. If you go beyond 2 eggs, I would say egg whites only. Then you could also have besan chila if you're vegetarian. You could have a sprout salad if you're vegetarian. You could have a paneer paratha if you're vegetarian. In terms of the fiber, fruits are great to start your day with. You can also have sauteed vegetables as well. If you're doing chila, for example, to target both the protein and the fiber, you could do the chila with a lot of grated vegetables in it. Then it comes to, let's say, if you're going to lunch next, make sure there is always a source of fiber in the form of sabzi. You can also, if you're able to digest raw vegetables without any bloating, then in that case, raw salad is also great. That takes care of your fiber. Also, whole grains are great. Millets, whole wheat, also great source of fiber. Then comes the protein part in the lunch. And the same can also be emulated in dinner as well. Make sure there's a protein source through pulses or legumes. And also, paneer is also a great source of protein. If you're ready to eat soy products, tofu is great. Soy nuggets are a great source of protein as well. And if you eat non-vegetarian food, then of course a serving of chicken or fish is also a great source of protein. And if you are snacking in between the big meals, make sure you're pairing a carbohydrate which is rich in fiber with either a good source of fat or protein as well. A great example of this could be having nuts and fruits together, or a Greek yogurt or curd along with nuts.
I would just like to add here that, we have simple solutions, and our daily Indian diet is actually very good. What happens is we don't practice that. दाल रोज खाना ज़रूरी है, especially when we are already in the elderly age. This is big problem of dentition, मतलब दांत नहीं होते, लोग सब्जी खा नहीं पाते और चीज़ें खा नहीं सकते, तो ये एक्सेसिबल होना चाहिए. इसीलिए वी हैव टू मेक श्योर कि आर एल्डरली घर में जो बड़े हैं एक बड़ी कटोरी दाल ज़रूर खाएं, एंड दैट में सफाइज. और दालें बदल बदल के खाएं, एक ही दाल ना खाएं. अरहर की दाल खाएं, उड़द की दाल, राजमा, छोले ये खा सकते हैं, बिकॉज इसमें प्रोटीन का कंटेंट ज़्यादा होता है. सोया की दाल बहुत अच्छी है, ये भी खाएं. सो दालें बदल बदल के रोज़ घर में बननी चाहिए, और बड़ों को ख़ास तौर पे दाल ज़रूर खानी चाहिए. एक बहुत बड़ी बात है कि वी हैव टू प्रिपेयर आवरसेल्व्स फॉर एजिंग, एंड द एजिंग आई वुड से स्टार्ट्स, well, it starts in the childhood, but at least we should become aware about this in the middle ages. अभी हम लोग ज़्यादातर लोग जो यहाँ पे बैठे हैं, we have to prepare ourselves now for aging. We have to prepare now with the help of yoga. We had a wonderful demonstration that we can do every day. हम लोग रोज़ कर सकते हैं अपने offices में. We have to start preparing ourselves with the help of the spiritual practices. That can be chanting, that can be Om, that can be Havan, that can be the different other practices like BSG. Whatever suits you, or whatever religion you practice, that is also a way towards spirituality. That can be with learning music, that can be with dancing, that can be with painting, that can be with just going out in the park and looking at the sky and the trees. That is also spirituality. Food is very important because that builds us. We are what we eat. So the food part is very important. Vegetables are important. Salads are important. Even if we cannot chew, now we can eat, but there are people, elderly, they may not be able to chew, so you have to give them in the way that they accept it. कद्दूकस करके या उसको मिक्सी में बना के, but वो चीज़ें शरीर में जानी चाहिए, तब हम सब जब वृद्धावस्था में आएंगे तो स्वस्थ आएंगे, एंड इट वुड डेफिनेटली बी अ वेरी ग्रेसफुल एजिंग. I would request very short messages from all our panelists. I'll start with Sonia, please.
So I would like to summarize my part of the panel discussion by saying that a lot of problems that we face don't start in hospitals, they start on our plate. So it's very important from very early on in our lives to start looking at how you're eating. So that is my message from a nutrition point of view.
Dr. Kashinath, sir, your message.
Namaste. As we know that in beautiful saying is there in the Bhagavad Gita, if you want to achieve the complete health, ultimately there should be integration. Yukta ahara viharasya, yukta chestasya karmasu, yukta swapna bodhasya, yogo bhavatu dukha. Yukti purvaka ahar, yukti purvaka vihar, good sleep along with yoga. When you do, then you are going to attain the complete health. And sir has stated, we are what we eat. But Indian knowledge system says that we are what we eat and what we digest. So if you want to digest what you are consuming, you need to have a good metabolism. To have a good metabolism, you need to be more active, adopt yoga in your day-to-day routine and remain healthy, wealthy. Thank you.
Thank you. Dr. Ishwar, sir.
Namaste. We live in our mind. Mind is the master. Don't control the mind. Give freedom to the mind. Mind is always moving. But only thing is, when you give freedom, it will orient. And with the orientation of mind, and we can manage many things in our life. We are talking about sleep, we are talking about metabolism, many things. It's only in my opinion, with my experience, it's just give mindful practices. Whatever you do, do it mindfully. Give freedom to your mind. So mind will be always energized. Yoga is not controlling the mind. Yoga is strengthening our mind. Yoga is to energize our mind. So we are to do that every day. Thank you.
Thank you, sir. And over to you, sir. What are your concluding remarks and messages?
In one of the sessions in industry in Gujarat, one participant asked me why we are not spiritual, though India is the land of the spirituality. So my simple answer was, because we have never explored spirituality. We have explored business, we have explored commerce, we have explored our so-called general knowledge about so many things, but we never talked or we never discussed. हम किसी को बहादुरी की कहानियाँ नहीं सुनाएंगे तो कोई कैसे बहादुर बनेगा? हम किसी को सद्गुणों की बात नहीं करेंगे तो कोई कैसे सद्गुणी मरेगा? हम बचपन से किसी घर में स्पिरिचुअलिटी की बात ही नहीं करेंगे और सोचेंगे वो स्पिरिचुअल हो जाए. There is no magic system like this. Long and short of this, that All India Institute of Medical Sciences has started an effort to develop a curriculum of spiritual health for the undergraduate medical education. I am one of the resource person for that. That's why noble. So all those who are sitting here, if you have any institutions, if you want that there should be a good working atmosphere in your hospital or in your venture, and if you want that your employees are spiritually oriented, I am here to help you. And the important thing is this, that we should start talking about the spirituality. When we will talk, then the things will happen. And other thing is this, that spirituality, I have already told, it complements all the things. It doesn't replaces anything, but it is icing on the cake. Whatever you do, your fulfillment, your purpose of life, your peace of mind, it is all on account of following the spiritual health practices. But we have to make it a point of talk, discussion and liking at our workplaces also.
Thank you so much, sir. And I think this panel deserves a big hand and applause from the audience. Thank you so much. Thank you so much.
Thank you very much indeed, sir, for that very interesting and a holistic session that we had. And may I once again invite Mr. Anil Rajput, sir, to kindly come up to do the honors of felicitating our eminent panelists. We begin with honoring our distinguished moderator, Dr. Rajesh Kesri. Thank you, sir, for wonderfully moderating this session. To Professor Dr. Kashinath. Thank you, sir. To Dr. Ishwar. To Dr. Deepak Shukla. And to Ms. Sonia Mehta. Thank you very much indeed, sir. May I request all our eminent panelists to kindly come forward in a group photograph with Mr. Anil Rajput. So ladies and gentlemen, that brings us to the conclusion of today's conference. We would now request all our distinguished delegates, participants, guests to kindly join us for lunch. Thank you for joining us once again. Do give us your feedback in today's sessions. And thank you once again. Enjoy your lunch. Have a wonderful day ahead. Safe drive home. Good afternoon and namaskar.